Settle down, everyone. Good morning, everyone. Our keynote, Healing the Healers, is a vital reminder to care for others amid exams and rotations. We are privileged to welcome Ms. Purvi Shah. She's a psychologist and founder of Mentally. With over 14 years of experience, dual masters in psychology, and a special B.Ed in intellectual dysfunction. Running her private practice in Dadar, Mumbai, she's affiliated with corporate schools, health centers, and NGOs, impacting over 10,000 clients all across the ages. From past roles at SRCC Children's Hospital, at Sion, and as a school counselor, a thought leader at P20 Talks in 2016. She burst mental health myths via Instagram, her clay art business, and a pro bono work, envisioning every Indian family with a counselor like their family physician. Please join me in a warm round of applause for Ms. Purvi Shah. Now, I would like to call upon the chief organizers to felicitate ma'am. Thank you.
Yeah, we can.
Yes.
Thank you. Okay, sure, sure.
Hello, hello.
Oh, great. This one.
Hello. Oh, I'm good. You can go and sit. I think all of you can go and sit. Hello, hi. Are you able to hear me well? Okay. Uh, so too much of sparsity everywhere. Try coming in closer because I'm trying to make this more not too much PPT and a little more application. So if you can or want to, please come in. If not, you're comfortable behind, that's fine too. I was always a behind bencher, so. Whatever you're comfortable with, it's absolutely okay. Is it okay because I think everyone's had their lunch? Is it okay to just do this a little more on the less PPT and more on practical side? Yeah? Is it okay if I just share what do you really have to do and understand with this topic? Yeah? Would it be comfortable for all of you? Great. Uh, so my slides are a lot heavy with matter, but I won't be talking about it. This is for you to see. I'll just keep going on with the flow. So today's topic is more about healing the healers, right? We're talking about burnout, compassion fatigue, secondary trauma, stress. Have you heard these names? Have you at least come across these names? Few of them. Burnout. How many of you know about burnout? Heard about of course, everyone, right? Compassion fatigue. Hello. Hello.
Thank you, welcome.
Thank you so much.
Thank you so
Thank you
much
so much for inviting me. Thank you.
We are so happy.
Thank you. Please have
I'm
a
sorry for this interruption.
Not at all, please. You're most welcome.
Shall we go on? Yeah. Okay. Is there anybody who's heard about compassion fatigue? No? Okay. So when you hold, of course, ma'am has. When you hold compassion towards somebody, when you're especially a caregiver to somebody, that's when you also start to feel a lot drained, because you're taking care of them. Do you think this is something that you may be experiencing, if not today, in some years? Because you are going to be the budding healers, right? And that's exactly why the topic today. So, these are the beautiful quotes that I have come across whenever I used to read a lot on trauma, whenever I used to read a lot on psychology, fatigue, compassion. So, we all know Viktor Frankl, right? What is give light must endure burning. The candle who gives light has to burn out, right? We come to the last one. The expectation that we can be immersed in suffering and loss daily and not be touched by it is an unrealistic or unexpecting, or as expecting to be able to walk through water without getting wet. Now, this is exactly what today's topic is about. How many of here are first years? First year students? Second year? More of second years. Third year? Fourth? Great. Okay. So, so the first years may be in a place right now where you haven't really witnessed a lot of this, but you'll start to witness it very soon. So this is like a preventive measure for you. The second years have already got the taste of the blood, and they kind of already know, not quite in a literal sense, but they quite already know what it would be about. And the third year, fourth years would be like, yeah, yahi ho raha hai hamare saath. Okay, so when you do talk to your clients, I usually use the term clients and not patients because for us in the field of psychology, they feel bad. Are we patients? Are we coming to you as patients? That's exactly when we start to use the word clients. Absolutely. Not even client. It's a give and take. If you say client, it becomes give and take, absolutely. So, when you're dealing with this person, when you're healing this person, what stays with you after the client shares something deeply painful? Have there been clients, have there been friends, have there been family members that you've come across who actually shared something painful with you? What is it that stayed with you? You could raise your hand and just answer.
Once a patient shared with me that he was having paralysis in one of his limbs, and yet he did not have any family. He had a daughter, but he was not talking. The daughter was not talking to him,
Mm-hmm.
and his belongings had just gotten stolen from him. So he was completely helpless. What really disturbed me was that I couldn't do anything to make his situation better.
After he went away, what did you feel? What was your sensation?
I was disturbed.
Disturbed. She uses the word disturbed. Has anybody else ever come across something like that, felt something like that? You could just answer chorously also, it's okay. Yeah.
Once I was in India for the pediatric posting, and there was two parents. Their kid had an uncurable disease. Of course, as stage parents, we try to assure them that we will take care, we will take care.
Yeah.
But they don't trust कि जब आपका बच्चा हो आपको समझेगा.
What did that make you feel?
I can't even digest.
If you had to use a word, a emotion word, a feeling word, what would you say I felt? Helpless, grieving, upset, yeah, bothered. Now imagine seeing 20 such patients every single day. What would you feel then? How do you safeguard yourself then? And that's exactly what we're talking about today. We've all heard this word stress. How many of you have felt it? Come on, we've all felt it, right? We've all gone through stress. Now, when we talk about organizational stress, काम करना है ये field में. Everyone knows of this word burnout, right? All of you know of this word burnout. Is there anybody who doesn't know the word burnout? Then I can explain. We all know what burnout is. How do you feel when there's a burnout? There's a lot of work, you're constantly working, there's no rest, there's no period of relaxation, your stress is induced. Yeah, that's when you feel burnout. And what happens when there are a lot of interpersonal issues? Now, there's not organizational stress. There's stress from what we spoke about, speaking to the clients. There's stress, well, come sit wherever you want. There's a lot of stress from friends, there's a lot of stress from work, from listening to your clients, and that's when you start to feel compassionate fatigue. I'm showing my compassion towards everybody, and now I'm feeling tired towards it. That's making me feel a lot more exhausted. Now, there's another word, vicarious trauma. Have anybody heard about this word, vicarious trauma? Just something we spoke about right now when I said, what if you have to see 20 such clients every single day? That's stress, fatigue coming in every single day, consecutively. And that's where you will feel vicarious trauma. Now, you know what? Surprisingly, it's so surprising that we're all very stupid, actually. I know a lot of you would agree. Why do I say that? Because these were actually the terms that were already discussed many, many years ago. They were some things that were pointed out many, many years ago. It is inevitable that the doctor should be influenced to a certain extent, and even his nervous health should suffer. He quite literally takes over the suffering of his patient and shares them with him. For this reason, he runs a risk and must run it in the nature of this. Carl Jung said this in 1966. And many more have already mentioned about these kind of issues that the healers go through. But then why are we yet not aware of the word vicarious trauma? Why are we yet not aware of the word, what we are actually talking about today, that is the secondary trauma stress? You know what's primary trauma? You know what is trauma? Does everyone know what is trauma? When I have trauma, it is primary trauma. But when I'm actually listening to you every single day, when you have trauma, what I feel inside is called secondary trauma. And how do we deal with that secondary trauma? Have we ever thought about it? It is so unfortunate that I actually have a lot of clients who are senior most in this field, doctors. I'm talking about cardiologists, I'm talking about dentists, I'm talking about neurosurgeons. Topmost hospital, top people from Mumbai coming to me for therapy, not realizing that whatever they are facing right now, the crux of it is this. Because I never took care of it. I was just daily going in and out saying, हाँ, तो यही तो job है मेरा. I've become doctor for this. Of course this was supposed to happen, right? But not necessarily. So the breakthrough actually happened. Now that I speak about this is already something that has been there from 1966. The breakthrough actually happened in 2015. So as psychologists, we have our Bible, where we have all the diagnostic criteria, and it's known as the DSM, Diagnostic Statistical Manual. When the DSM-5 came out, it actually pointed out this statement. Experiencing repeated, the one in purple, experiencing repeated or extreme exposure to aversive details of the traumatic event. Example, police officers repeatedly exposed to details of child abuse. When this was actually in the book, that's where everyone started to accept the term secondary trauma. So now that is exactly why you need to know this term. It is out there, definitely it has been out there, but now it is legally put on paper. Right? What is secondary trauma? We actually spoke about this. Re experiencing personal trauma. Maybe I myself have some trauma from the past I've not dealt with, and that comes off. So, say, example, I've already have had a childhood experience in the past, which was traumatic. And my client comes to me and talks about the same experience that I had forgotten, but got re traumatized just because they spoke about it. And then dealing with it becomes difficult. And then suddenly I'm thinking, last 4 दिन से नींद नहीं आ रही है, पता नहीं क्यों. Nothing has changed. I'm absolutely okay. I'm having a good meal. The stress was there, but now it's not. But I don't know what has changed. It just could be this. Changes in memory and perception. You've started to be a little more forgetful, absent-minded. Depletion of personal resources. You all know about it. How do we deal with our daily, how do we take care of our daily life? Right? Disruption in perception of safety, trust, and independence. We'll come back to all of it, which is why I'm just brushing through this. Why would you be experiencing all of this? One thing we've already spoken about is if I do hear these stories every day, if I listen to my clients talking about how they've felt so traumatic every single day, I am going to feel what I'm feeling, right? Apart from that, if I'm a person who's a little more empathetic than general, that's where my compassion fatigue goes on beyond the level and crosses and becomes a secondary trauma. Because now I'm not able to detach myself. Sympathy, my empathy has become sympathy. Measuring self-worth. How many of you, I shouldn't even ask this, we're talking about Munna Bhai. Munna Bhai, I think part 1, MBBS, where this girl gets up and says, I want to become a doctor because I love helping people. And then he says, we're not here to help people. Now, why would she say that? Because, just what I said, as doctors, this is my duty. You have to be there. The Hippocratic oath. I have to be there for people. So, that also comes from a place of low self-worth. Because if I don't help them, then am I a good person? That's a question on myself. So when you have a poor self-concept or self-worth already, it can become an issue. Unrealistic expectations of yourself and others. Again, on the same lines. What am I expecting from my clients? What am I expecting from myself? Yeah? Now, I think one of the things that I would like to do is, we'll come back to all of that. Hazard assessment. What does hazard assessment mean? I know something is going to happen, conditions, events, or circumstances that could lead to or contribute to an unplanned or undesired event. Why are we talking about this? Because the primary reason for assessing hazards is to attempt to prevent them from happening. Do you all have a smartphone? Do you have notes in it? I'd like you to use that. Let's do something small. So I'm going to ask you certain questions. All I want you to do is make notes of it in terms of number. Whether you resonate with it on almost never, 0, occasionally 1, often 2, almost daily 3. Yeah? So you're only going to write the number 0, 1, 2, 3. That's all your job is, okay? Fair? Should we start? Everyone with me? I feel emotionally drained or overwhelmed by patients' traumatic experiences. Now, for the people who are in their first years, they could consider this as either you've spoken to somebody who's not necessarily a patient, but you felt that, or either this is just a feeling that you're carrying because of it's not easy to be in the first year itself, right? So stick to the questions according to that. It's 0, 1, 2, 3. I'll go back to this slide again. Understandable? Should we go ahead a little faster? First one is I feel emotionally drained or overwhelmed by patients' traumatic experiences. Second, I have intrusive thoughts or memories of patients' traumatic experiences. I'm done seeing my patients. But after the clinic, after I've seen them, I still seem to have these experiences that are there with me. Do I think about it? 0, 1, 2, 3. I avoid discussing patients' traumatic experiences or situations. I'm avoiding. Why am I avoiding? Not because, it's not fun, just because I want to avoid that feeling that comes along with it. 0, 1, 2, 3. Does that happen to you? I feel anxious or hypervigilant when working with patients who experienced trauma. Now, when we are talking about trauma, I want you to remember we're talking about any kind of trauma that is personal, that is an abuse, physical trauma, uh, sexual abuse, or physical abuse, right? Any kind of trauma. Are we together? I feel emotionally numb or disconnected from patients' experiences. They're saying something to me. Yes, please.
So how do you include physical illness like cancer, heart disease?
Yes. Yes. Ma'am's absolutely right. We're also including traumatic experiences, illnesses, chronic illnesses, where we're talking about cancer, we're talking about other. That was not my call, that was my alarm for. I have to go faster. Sorry. Yeah, it's on. Is it on? No? Okay, we'll go ahead. I struggle to shake off disturbing events or thoughts from work. I'm off my work and I'm still struggling to shake that feeling of what I had at the OPD. 0, 1, 2, 3. I feel irritable or short tempered with colleagues or loved ones. दो रोटी बनाओ या चार बार बार क्यों पूछना है? And you get really frustrated and then you even think about it. Why did I get so flustered? It wasn't necessary. I feel like I'm not doing enough to help patients. Is that feeling there? 0, 1, 2, 3. I experience physical symptoms, headaches, sleepless nights, low appetite when thinking about work. I hope we're all together. Is anybody missing out on anything? Great. I feel like I'm losing empathy or compassion from patients. For patients. 0, 1, 2, 3. I feel isolated or withdrawn from colleagues or social support. They're asking me if I can go out late in the evening, but I don't feel like doing anything. I worry about my abilities to handle traumatic cases. 0, 1, 2, 3. Now all I want you to do is total it up. Just total up the score. Done? How many of you have scored 25 and above? Just raise your hand. How many of you have scored 13 to 24? Don't do a ho, yeah, you will be there in some time anyway, I'm sure I'm telling you. Because we're not aware of it. It's not like we're avoiding it, we're just not aware of it. 12 points? 0 to 12? Okay. Anybody below 5? Anybody below 5? Great, you have the least stress. So it seems. Okay, I want you to remember this is not a diagnostic test. Okay, we're just doing it to understand and be aware of what we're really feeling. What can we do? Let's start talking about that. Okay, we've spoken about how we feel today. Now, there's one more thing that I can probably do with you if all permit, and yeah, I think we have time. Uh, should I actually tell you what goes on in a therapy classroom? when we when we speak about healing the healers, and I can just put all of this away. Yeah? Have you all heard about the word mindful? Mindful. Is there anybody who's not heard about the word mindful? So there's one thing mindful, जहाँ mind में बहुत full है. Your mind is full of too many intrusive thoughts. And then there's something known as mindful, where you are in the present, where you're aware of things, you're much more relaxed, and you're much less on the stress level. Yeah? Now I want you to rate on a scale of 0 to 10, 10 being highest, how mindful you are. And just keep it to yourself. Just think how mindful do you think you are. And just keep it to yourself. Okay? Now let's do one thing. I'm going to guide you. All you're going to do is close your eyes and sit. And you're just going to listen to my voice. And at the end of this, you will tell me if that number that you had in mind, does that really feel just to what you felt after? Okay? You know what mindful really means? It means how aware I am. How aware I am of my today. How aware of I am of my orientation. Where am I? What am I doing? My body. All I want you to do is just close your eyes and just listen to me. Yeah? You can sit back relaxed. After this, I guarantee that you will feel a shift in your entire body. Okay? All right. Close your eyes. It's going to be fun, really. I want you to focus on the top of your head. All we're doing right now is we're going to close our eyes and just focus on what's happening in our body. Okay? All of you know that there's something happening in your body, but you're not aware of it. I'm just doing this activity with you where you're now going to realize how aware you are about your body. Most of you will agree with me when we say that there are emotions that reside in the body, we're just not aware of it. So let's see how many emotions we have in our body, where are they, and what is happening. While you're listening to me, you're focusing on the top of your head. You're just going to scan each part of your body to see what sensation there is. And there's 100% some sensation. It could be tingling, it could be struggle, it could be some kind of pull, it could be something hard, it could be anything. That's okay, just notice it. Is there anything on the top of your head? Let's go down to the forehead. What do you notice happening in the forehead? Is there something you notice? Is there something you notice in the forehead? Try coming down to your chin. What do you feel there? Check throat. Is there something happening in your throat? Is there some kind of a lump? Let's come down a little bit more towards your chest, your rib cage. Is there some sort of feeling there? Do you feel some pull? Do you feel some sort of tightness? Just notice it. You don't have to be answerable to anybody. Just notice it. As you're noticing it, focus on your breathing. Are you breathing? Are you breathing in? Are you breathing out? Just focus. Try coming back to your stomach. Check if there's any feeling in your stomach. How does the shoulder feel? Do they feel heavy? Do they feel okay? They could feel okay as well. Just notice. How does the seat feel through your buttocks? Does it feel very heavy? Does it feel light? Just notice it. Is there any sensation in the feet? Does the feet feel heavy? Any other sensation? Just notice. As you're noticing, go back to focusing on the breathing as well. Continue breathing. Check if you're breathing in or out. Come back to your chest area. Did you feel something there? How does the rib cage feel? Is there something in your palms? Some sensation in the palms? Just notice it. As you start to feel that calmness in the body, you can start to come back. Slowly you can start to open your eyes and come back in the reality. 3, 2, 1. You can come back. So coming back to the number that you had given yourself, how mindful you were, is that still the same? Do you still feel that I was aware of all of these feelings in my body already when I gave that number? Is there anybody who was aware? It's okay. You could be. Do you realize how many of you felt something happening in their body? How many of you felt the sensation in their body? Did you feel it? Just raise of hands. Did you feel that there was some sensation that I noticed that I did not notice earlier? Do you also know that the sensations don't come in unless there's something happening over here? Does that also mean that I am struggling but I am not aware of it? And that is how secondary traumas are caused, when you're not aware of it. Yeah? So we've spoken about what secondary trauma is, but what can you do so that you don't get them? Because you are going to be talking to your patients, you are going to be helping them every single day, no matter whether you're in psychiatry or whether you're in any other field, right? So what do you do? Do any of you anyways do something that helps that you can share? Maybe you already practice something, some yoga, some meditation. Yeah. You exhale more. Yeah, so that's a normal practice. Yeah. So again, that doesn't come easy. Yeah. I'm sure this takes a lot of time. Let's try this, what he said. Let's inhale for 4 counts and let's exhale for 8 counts. Okay? I'm just going to give the counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Try doing it again. Inhale. How does that feel? Difficult, right? Yeah. So, you know, what you're saying is something that can actually help you when you're sitting with it. But in your daily life, what do? Right? Every day, what we did right now is actually called a mindful practice that you use the most with trauma clients. I mean, we use it more with trauma person. So the person who comes to us with an episode, a long-term episode of complex trauma, we would usually start with this. Do you know, now let's talk about a little about psychology and psychotherapy. How many of you agree that you go to a counselor because you have to vent? You go to a counselor to vent, right? And venting is cathartic? Yeah? How many of you? Raise hands. How many of you feel that's true? Raise your hands if you feel it's true. Do you go to a counselor to vent? Do you go to a therapist to vent? And the ones that are saying no, what do you go for? But when do you go to understand? You know, I have clients, parents who will call me and say, मेरे बेटे को देख लो, बस उसको convince कर लो आने के लिए, उसको आना नहीं है. Or the other way. Some son is calling me to tell me, my father won't come to you, but he really needs help. Will you just speak to them? And all I have to tell them is, if they're not ready, they will not come, let it go. You know, when do you go to a astrologer? When nothing is worked. You know, when do you go to a psychotherapist? When nothing is working. I've tried everything. Nothing is working. Now I need to go to a counselor. That's when you go to a counselor. So unless you feel that there's something wrong with me, and that day when I can't help myself, that's the only time when you'll go. You will not go for yourself to analyze yourself. That's never when, that day never comes. Because you're in a good space. Why do you want to go? I feel I can deal with myself. Yeah? So let's come to practical applications of this. One thing that you will be doing every single day is this, what we did. About 5 minutes, 7 minutes, just being mindful about what's happening in my body. When we are sitting across the clients, we're also taking care of what's happening in my body, and I'm also taking care of what's happening in my client's body. How do I do that? By observation, by checking how he's breathing, by checking when he's zoning out, when he's not. A lot of times, there's a word known as mirroring. I'm not sure if you're aware of this. If as a client you are feeling something, and I'm sitting in front of you listening to you, and I'm understanding what you're saying, I also start to feel the same thing that you're feeling. So, where would anxiety be mostly be shown? Chest. Mostly. So if I am in a room, in a therapy room, and I am feeling something heavy in the chest, but I was just happy when I came in the therapy room, then why am I feeling heavy in the chest? Because my client is feeling heavy. So I tend to ask them, are you feeling heavy in the chest? Is something okay? Is something not okay? And that's when they tell me, yeah, how did you know? So these are the subtle signs that we know as therapists, that something is happening there. They're not told me, but I already know about this, right? So one of the things that you will do when we talk about secondary trauma is actually doing the mindful practice every single day. You can maybe start your day with it, maybe end your day with it, just 5 minutes, that's all, yeah? More to do with preventive measures would be this. Just taking care of the symptoms. What we did when we were talking about the question and answers, when I gave you the questions and you were rating yourself, was basically you were trying to understand what secondary trauma really is. Those questions, if you were feeling anything like those questions, then you're feeling secondary trauma. So you already know the symptoms by now. I don't need to go back and tell you what the symptoms are, right? It's as simple as everything was happy, hunky-dory in the start, which is the green part. As the green part becomes yellow, I start to get a little bit irritated. Something is not well. My sleep is started to get disturbed. Suddenly, my girlfriend is complaining about me, which didn't used to happen earlier. And then the red flag, where now I'm avoiding my girlfriend completely because she irritates me. Yeah? If you can be aware of this, then you've won half of the battle. Because the first thing is always about awareness. Yeah? Organizational wise, how do you take care of it? So, in psychology, we have our supervisors. So, as a therapist, when you're becoming a therapist, the first thing that was told to us was go and see a therapist. Before that, we will not give you the degree certification. Why? Because unless you are in that client seat, how would you know what it feels like? Unless you have dealt with your own trauma, how would you know that it needs to be dealt outside somewhere? If a client is coming to me with an anger issue, and I already have my anger issue, how can I help him? I can't help him. So I need to take care of my own issues first. So that's when we go to a to a therapist ourselves. Another thing that we do in our practice is having supervisions. So we have our seniors where we discuss our cases with, in case there were cases that were not very well dealt with or were difficult ones, so to say. So probably you would also have to do that, where you have a guiding person you can go to. That's your first. This is what we are talking about when we are talking about organizational part. We very well know how good our institutions and government are. Let's not even get there, right? You might get help from there as and when you put in your grievances, but you don't know when the grievances will be addressed, right? So you can wait for that to come. But over and above, on an individual level, what can we do? Self-care. What is self-care? Spa jao, meditate karo, yoga karo, everything that everyone will tell you. Go for walks in the morning, have a routine, have a lifestyle, eat well, eat healthy, sleep well, right? However, unfortunately, that doesn't always help. Did you know Mother Teresa? Now, this we are talking about something in the 70s. Again, 70s, 80s probably. She actually had this policy. For the nuns who used to work with her, she used to ask them to take 1 year off amongst the 4 to 5, amongst 4 to 5 years, you can take 1 year off and deal with your trauma because it must be too much to just listen to somebody. What was Mother Teresa and the other nuns were doing? They were listening. Were they actually doing something that the doctors would do? Were they practically giving medicines or performing surgeries? No. But they were healing with their words, with their whatever community help that they could provide. But then why did they need 1 year of gap? This exactly. Secondary trauma. Which is why I say that, secondary trauma is something that we have been speaking about for many, many years, generations. We've just never discovered it. So while your rating scale already tells you what it is. Yeah? So now that you've rated yourself, after 1 year, what would the rate be like? Samajh lo. Yeah? Another thing that you can easily do right now to understand is to check where you are. I've already made this much more easier for you. Do you see those parameters? Self-care, work, intimate partner, yeah? All I want you to do is, just besides this, put a number. The total of this should be 100. Okay? Just put a number and see how much time you're able to give to each. How much time do you actually give to each? How many of you perform spiritual aspects, spiritual practices on a daily basis? Okay. Few hands. How many of you actually spend life with family on a daily basis? Sometimes it can be too much. How many of you actually do some kind of exercise, physical exercise, every day? We're talking about every day. That's actually good. Yeah? Is this more understandable now? Put this on a pie chart and see where you belong. You don't have to deal with it alone. Sometimes you're not the therapist, so don't try to become one. When you know it's a problem, just go to somebody, get it sorted. It doesn't have to be professional. It could be anybody. Do you have your support system? Do you have friends you can go to? Are there cheerleaders in your life who actually can be around you when you win, when you lose? That is what counts here. So that's why I said self-care practices isn't something that can go for a very long time. Okay? So what you will actually have to do is decide who your support system is going to be in such times. Yeah? Again, we've already spoken about all the strategies here, right? Very basic. You know, this is something that every motivational speaker will tell you, every other talk person will tell you. How do you take care of your mental health? By doing all of these things, changing a lifestyle, right? Something that nobody tells you is okay, we can just go. Something that nobody tells you is how do you listen to your body? What we did today was listening to our body. Any good voracious readers over here? Do you read books on trauma? There was a very good book that came out. This was by Gabor Mate. Have you heard the name? So the name of the book is The Body Keeps the Score. So he's a trauma therapist, and he came up and he talks about trauma and how trauma survives in body. And this actually became very viral. And now everyone talks about this. Everyone, even if they're not professionals, but they want to be a motivational speaker, they'll talk about this. There have actually been researches where they tell you trauma is set in your body. So what do you do when you go to a therapist? They tell you, "Acha, bura lag raha hai, let's talk about it." You talk about it, try to change your thoughts, and then you start to feel better. But after a couple of years, you're still not okay. Why does that happen? Because you've dealt with your mind, but you never dealt with your body. Because the trauma is still there in the part of your body. Yeah? So that is what trauma is all about. Yeah? With that, I think I'm going to end for today. And I will like to take some questions or any more. Sorry. I'll just try to take up curiosities from your side. And yeah, is that okay? Yeah? Okay. So that's about me. Any questions? Is the concept of secondary trauma understood? And have you understood how this is different than a burnout, or how this is different than compassion fatigue? Yeah, yeah. You have to build one. So this is the most common thing somebody will tell me. We don't have friends anymore. We don't have people who are available to talk anymore. You can't always be running to a therapist. Your therapist is also expensive. She charges exuberantly for 1 hour. Yeah? I mean, I've been through the same thing. This is no different, right? I've felt the same thing. But there's nobody to talk to. What do? You find people. You get attached to groups which are of similar interest. You build your own community. You try to engage in community practices where you're more visible around social people. Yeah? Because you cannot, at the end of the day, you're a social animal. You will need a support system. You will need an ecosystem where people are around you. So that building takes a longer time anyways. So you can start from today. Yeah. Any more questions? You can ask me anything related to therapy or psychology too. Yeah, yeah, please.
People would ask someone to have some time for you. Nowadays we are busy in the mobiles for hours together for some virtual friends. Real friend, if you say to find out to speak to someone and they have time for us to listen, it is difficult to find. In practical scenarios, we have seen various countries also abroad. There are various countries abroad who don't have people to speak to. They don't have relatives. They are all alone.
Hmm.
They have some helpline numbers
Yeah,
basically government
yeah.
has made. This is something available for us in India.
So, so to be very honest, every client who comes to me tells me, I want to talk to people on the dating app, but people don't want to talk back on the dating app. And then I'm seeing how is every person on the dating app feeling the same thing that they want to talk, but others are not there to talk. So where are these people going? I'm not understanding. Right? So what I'm trying to tell over here is that it's just that you're not connecting with the right people. Everyone here is lonely. Let's accept it. We are all a bunch of lonely people. If you're saying I'm finding my solace of loneliness in the cell phone, you probably can find it in other way also. Anyways, you're doing it all solo when you're using your smartphone, right? Why don't you try other activities solo? Maybe it works out something. Maybe something might just work out. Is that answering your question? And over and above that, talking about the groups that are available, there are too many groups available. I also know of a lot of Facebook communities where they have, so say for example, I'm a marathon runner, I'll join these marathon running groups. And then you find people of similar interest. And that's how you build a better community with like-minded people. There are a lot of communities for people interested in meditation, yoga. There are a lot of communities, people interested in midnight cycling that's going on around in Mumbai. Yeah. I mean, many years ago, I remember when my college time, there were these groups that used to take you for trekking. Yeah. Why don't you try one of those? And I mean,
Government initiative from our center. Recently, I was reading something on mental health. The government has done lots of things in mental health. So there were some numbers, but are this counseling part available on those numbers that we see?
oh, sure, no. So we have a lot of helplines. I think one of the ones started by government is the Tata Institute helpline. I forgot what it was called, but and it's still running. It is still running, and in fact, if you go on my Instagram page, there's also like I've kept like an entire post where there are all the helplines that are available. There are all the pro bono therapists that are willing to help. So you can find all the information there. Yes.
Does gossip help to release trauma? I mean, if it's a psychology
Is
question.
gossip healthy, unhealthy? How many of you say healthy? The moment I said how many were they saying depends. This is exact topic that I was speaking to my friend just day before yesterday when I met her. And she said, it was nice gossiping with you after a time. I said, we didn't gossip. We were just catching up on things. So it depends on what you call gossip. If you're talking about something in a more judgmental way, it just means that you have a tendency and expectation that you don't want to change. Your, what's the word? Uh, People are not as open-minded as they say they are. And that would come across in a gossip format, right? So if I'm just generally talking about everything that's happening around, and I'm getting the knowledge of it, it's okay. But if you're judging the knowledge that you're getting, that would not be healthy gossip. Is that better in understanding? Yes. I'm sorry, what is toxic? Residency. Yeah. Um, Stop following such pages and follow my page. And call me for podcast so I can give you right information. Uh, no, how would you become, if you become toxic, you could be a different kind of toxic. I mean, that doesn't even make sense. Why is residency toxic? What is happening in residency? You know, the first thing that I tell my clients, my first session with my clients is more to do with orienting them to what is therapy. Because बाहर से सब सुन के आए हैं, therapy क्या है, क्या नहीं करना है, क्या करना है, but I need to really tell them what will happen inside the room. आना है तो आओ, वरना मत आओ. Because I need to really tell them that this is what we need to do. The first thing I would tell them is, you know, you're the troubled one. The world has actually troubled you, and you've actually come here as a troubled one. But you know, unfortunately, the world is not coming to me for therapy. Who's coming to therapy? You. So who's got to change? The world will not change. The only thing that happens in therapy is when you go to a therapist, you've changed. So now when you go back in the same world, it doesn't affect you. Because you've understood what was the triggering factor and you've dealt with it. So you need to understand what is it that's triggering in the residency and deal with that aspect of it. Does that answer your question? Any more questions? Thank you, everyone. Yeah.
Did you ever interact with people who were obviously red flags, like when they came to you, and they did not realize it themselves? They are
You mean professionally?
more like personality.
All the time. So an unfortunate part, I mean, I will call it unfortunate. Is unfortunate part of my work is that I'm always diagnosing. So even in my work, I do very less of diagnosing because I feel that diagnosing से क्या ही होगा? मतलब even if I called you an autistic person, क्या ही होगा? It doesn't resolve anything. Even if I called you something else, it doesn't resolve anything, right? Let's talk about how can it be resolved rather than diagnosing. But if you're talking about somebody who was problematic, I don't like to use the word red flag because what is red to you may not be red to me. Yeah. So, yeah, there have been a lot of people who have come across who even today come across as so-called red flags. And what do I do about it? I smile and decide that that's the distance I want to keep. Setting healthy boundaries is very important. One of the things that we discussed, one of the things about self-care, how do you have a self-care? If I can just take you back to the slide. Learn to say no whenever needed, or yes whenever needed. If you don't know when to say a no, and if you don't know when to say a yes, you will end up having the trauma. Because you're taking too much that you can't take. Just because somebody else has the capacity to take it, it doesn't mean you have the capacity. Just don't. Yeah. Yeah.
So practicing now, because many times we feel like daily we see the patient, lots of patients.
Yeah.
Generally they come with some negative thoughts, or basically they are not in a good stage of mind.
Yeah.
Now we are always clear with them. You have to emotionally back up them sometimes physically
Yeah.
that okay, it's fine, things is okay. The unfortunate thing is we are dealing with a patient is as such very weak and all those things.
Right.
So that is happening throughout the day.
Yeah.
For a doctor part, be on the positive side every time. Can you suggest something?
So see, our work is not very different than yours. In terms of taking trauma, in terms of taking the emotional burden is what I'm talking about. So what we practice is something that you also have to practice. So something that we did today is actually a practice that I follow every single day. There was a time in my period where even I felt the burnout, right? Because I've been working for years and years without a single break. Even the COVID time, I wasn't taking a break. In fact, before COVID, I was actually attached to 8 spaces. So that was a lot, but I was enjoying it. But you feel you're enjoying it, your body's probably not ready to take it, right? So right after COVID is when I realized maybe I need to slow down. Maybe I don't need to slow down, my body is asking. So then you actually start to practice everything that you tell your clients to do. What time do you wake up? Do you go for exercise? It's just you have to maintain that level. Positivity doesn't come in mind. It comes with what's happening every single day. How involved are you in what matters? What affects you, what doesn't? So as long as you practice that every single day, you're going to be perfect. You don't necessarily, there's no necessity that if you are a doctor, you will experience secondary trauma. It's not a for and, you know, there's no clear-cut understanding about why it doesn't happen. The only thing why it doesn't happen is because you're very careful about your lifestyle. You've been very careful about what I think, how do I speak to people, what are my thoughts right now, what is my tone of voice when I talk. Yeah. Should we?
Thank you very much, ma'am. We are truly grateful for such an interactive session. You made it really fun for us. And we care a lot about your views on burnout, on organizational stress, on interpersonal reasons. So I think a lot of us has taken quite some takeaway points from this session. I believe so. So please give us a round warm of applause for ma'am. Now I would like to call upon the chief organizers that to please take a small token of gratitude from us. We thank you very much from Ascension 2025. The next workshop will be on digital detox. Please stay here and it will begin quite shortly.
Workshop will start at 2:30 p.m. Request you all to wait. खत्म हुआ? बोल लो उनको. साउंड वाले तो आ रहे हैं.
अरे मैम को एक्सपोर्ट तो कर. मैम इसे अकेले की छोड़ रही हूँ. The next workshop is at 2:30. Please be seated. We'll begin that quite shortly. क्या करिए?
डिजिटल डिटॉक्स के लिए सब.
हाँ देखने दें एक बार.
Thank you, everyone.
That was really wonderful session, ma'am.
हाँ अभी तक निकाल सकते हो. ठीक है. चलेगा. Guys, sorry, I really appreciate, but yeah, again, SBS sir. It is ready. Not the slides. I guess ma'am will upload it when she comes.
मैंने सीड वाले से बात की.
हाँ.
उनका बैकड्रॉप कुछ भी नहीं है. असेंशन का ही रख देंगे.
Best.
उनकी कोई पीपीटी नाही कुछ नाही. वो सीधे माईक से माईक त्यांना तो हा माईक द्यावा लागेल आपल्याला. वॉक होते जो पण असतो. आणि अंजली मैम का है
हाँ वो लेके आ जाएगा प्लीज.
सीपीआर वर्कशॉप. हाँ वो तो
Yeah, there are 6 pens. 6 है. 6 है. हाँ लेके आ. कुछ नहीं.
अरे
It's manageable. You just
ते डेझीचा कॉल आलेला. म्हणे ऑडिओ रेकॉर्ड करायला तुमच्याकडे इक्विपमेंट आहे. ती मी म्हटलं व्हिडिओग्राफर आहे फोटोग्राफर आहे आणि साऊंड सिस्टीम वगैरे सगळी प्रेप केली. ती बोलली व्हिडिओ रेकॉर्ड करायचा. मग ते चालणार आहे. ते माईक असतात ना त्यांचे. बोलली की वी वुड ब्रिंग इट.
but can it be connected to here?
आय गेस त्यांचा पण कोणतरी येतो
Sound guy.
व्हिडिओग्राफर.
अच्छा फाइन मग हो जाएगा. Shum doc will take more 15 more.
सीड पण होतं. क्या हुआ?
Charging.
Welcome to the digital detox workshop at Ascension. This is designed to help us reclaim focus and balance in our screen saturated lives. So put down your phones, focus on the workshop. We are honored to welcome Dr. Kothari. She's a distinguished Mumbai based psychiatrist holding MBBS and DNB in psychiatry with specialized expertise in anxiety management, de addiction, sleep disorder, and digital wellness. She is famously recognized as the India's most trusted celebrity psychiatrist. She's a dynamic speaker and advocate for those who integrate evidence based psychiatry with practical strategies for mental health. Please join me in a warm round of applause for Dr. Angelika Atre. I would like to call upon the chief organizers to first to felicitate ma'am. Thank you.
Hello everyone. Good afternoon. So I'm Dr. Angelika Kothari. So I'm not going to keep this lecture very boring. Okay, I see a lot of students in lab coats and all running probably from their classes. Mic is okay, right? Am I audible till the end? Okay. So let me ask you this question. So what is the most important thing in a medical student's life? Anybody? What is that? Proxy. What did you say? Tell me. Come on. Sleep, yes. Hold on to that answer. I'll come back to that later. So, what do you think is the most important thing? Intern. Intern, yes. Studies. And what about time? Also important. Not very important. Where do you think most of your time goes? Okay. So yesterday I had this moment which actually made me really laugh. I was replying to a patient's query and then another patient's message, and I was also supposed to make a PPT. वो तो मैंने last moment बनाया था. I was supposed to reply to this Shubham also questionnaire बनाने के लिए. I thought सब कुछ 2-3 मिनट का काम है. I'll multitask, I'll do it and everything. And suddenly 40 to 45 minutes later, I realized that I'm on Instagram. धुरंधर का, अक्षय खन्ना का entry reel देख रही हूँ मैं. And surprisingly, I'm enjoying this, man. I mean, come on, वो अक्षय खन्ना है. मुझे तो पसंद भी नहीं है. Does that happen with you guys? Or that Virar jump on, jump off transition reel? Has anyone seen that reel? नहीं, सब पढ़ाकू बच्चे हैं, right? Okay. So yeah, why do you think that happens? So we actually end up doing something on phone and we don't even realize कि 2 मिनट से 40 मिनट से 1 घंटा से 2 घंटा हो जाता है, right? Does that happen? Yes, that happens. That happens because it has become a conditioned reflex. तो कौन से year के बच्चे हैं mostly यहाँ पे अभी? Mix. What is mix? Okay. So conditioned reflex आग तो पता होगा सबको, I believe. पता है, right? So it is like a conditioned reflex, right? That I don't even realize it, but somehow I happen to do it, right? It happens very much at a very spinal level or a very subconscious level, right? So as doctors, as medical students, we study about. देखो पीछे एक बच्चा notes बना रहा है. This is multitasking. So as medical students, we talk about, all of this beautiful neurochemistry, dopamine, adrenaline, serotonin, norepinephrine, everything we talk about this, right? Glutamate also. पढ़ा है अभी नहीं पढ़ा? पढ़ लिया होगा ना, थोड़ा बहुत तो पढ़ा होगा. Proxy लगाएंगे तो नहीं पढ़ पाएंगे. ठीक है. So, but we think we are smart, we know about this neurochemistry and everything. But you know what, tech people, they are very smart. They do realize that dopamine is important. Like as humans, we really need a lot of novelty in our life. We all need dopamine. We need something that keeps us motivated, something that keeps us alive. But, these people, they do not give us dopamine exactly. They give us micro dopamine. Has anybody heard this concept of micro dopaminizing ourselves? Micro dosing? Micro dose समझते हैं? Like let's just split it out, right? Micro and dosing. What happens is that, see, if I do some activity, let's say I go for a run, I'll go for a 40 minutes run, I'll have to walk, I'll have to sweat it all out, right? 40 minute के बाद मुझे feel good factor आएगा, the endorphin rush, that adrenaline rush, right? I don't want to wait for 40 minutes. I don't. I need an instant gratification. So how do I get that? Let me just doom scroll, right? Then these activities which need a lot of effort and everything that makes us very happy, these are now very effortful. So why do I do this? I will watch a reel, I will get this micro surges in the dopamine, and I will feel good. That will be an instant gratification. I will feel good for a smaller period of time, but the idea is that मुझे 3 सेकंड की रील देख के 3 सेकंड में ही अच्छा लगेगा, तो मैं 40 मिनट का रन क्यों करूं, right? That is clear? Okay, so these are this is the concept of micro dosing basically. These digitalizing ourselves. Now we stay in this world of phone. We are so hyper connected, right? अगर किसी के पास phone नहीं होगा, then you might start feeling FOMO. अभी अगर आपके पास से हम दो दिन के लिए phone ले लेंगे, would you feel that I'm missing out on something? कॉलेज का या क्या आपके क्लास का व्हाट्सएप ग्रुप में क्या चल रहा है, किसकी फोटो आ रही है कि क्या नहीं पता चलेगा, राइट? you'll have FOMO. Why? Because it's not giving you that dopamine rush anymore, right? So as medical students, I believe phone and iPads and all of these digital devices are our lives. How often do we use our phone in a day? I mean, pretty much all the time, right? In the middle of a boring lecture, right? For requesting a proxy also. Leaked questions को circulate करने के लिए use करते हैं phone. Most important questions, ठीक है. So, but we don't realize that there is a very fine line between using it and making it a huge distraction of our life. That line is very blur and we don't really realize it. Right? कोई second year dude है यहाँ पे जो gym विम जाता है सारी लड़कियों को impress करने के लिए? ये gym जाते हुए notes क्यों बना रहा है पीछे बैठ के? और पीछे क्यों बैठा है फिर? तो क्या नाम है बेटा आपका? श्लोक. तो कितने दिन हफ्ते में जिम जाते हो? 6 दिन. एक दिन क्यों नहीं जाते फिर? रेस्ट लेते हैं. Why do you think rest is important? For recovery of muscles. और फोन दिन में कितनी बार यूज करते हैं आप? Pretty much like probably 4-5 hours, right? Do you take a day off in a week where you don't use phone? No. Does anyone do that? Do you not think recovery for our brain is important? I mean, it's very important for your muscles to get this recovery, right? But it is also important for our brain to get this recovery. अभी क्या होता है ना, we are constantly using the phone. There is no period of time when we are not using it, right? You will probably use Instagram and Snapchat and you'll use WhatsApp and so on and so forth. So we remain in a state of this constantly, we are overstimulated all the time. All the time we are overstimulated. Dopamine हमेशा थोड़े level पे, micro level पे बढ़ा हुआ रहता है. But as we understand cognition, that we need a phase of time, we need a space in that mind, we need that time where dopamine gets replenished, right? Just like that 6th, 7th day of the week where you take rest for your muscles to recover, we need that some time in our day where we do absolutely nothing. We let our dopamine in our cognitive, processes replenish. That's when the recovery will happen. Also, sleep is also very important. Sleep is one thing that will lead to dopaminergic recovery. But again, if we are hooked to the phone, so I plan to probably sleep at 12 and then, I am watching something. I'll think that I'll use it for 15-20 minutes या 12:30 तक देखूंगी, but turns out 2:30 बज गया है रात का. Does that happen? Yes. And then you happen to miss the morning PSM lectures. That happens? That also happens? That happens. Okay. So that has happened again for the very reason we are so used to being overstimulated, because at smaller levels, it is giving us that dopaminergic rises. And we like that. And whenever there is a fall in the microdopamine, we want to chase it again. So digital addiction works very similar to a substance addiction. So substance addiction में क्या होता है? For example, somebody is addicted to alcohol, right? So पहले they will start with a 90, then they would want 2 of 90, and then there will be 3 of 90, and then 1 quarter and 2 quarters. You understand, there's a tolerance that builds up. Why do you think the tolerance builds? Because now I want increasing amount of alcohol, for example, or increasing amount of cannabis, for example, to get the same high, right? Because now my receptors have gotten tolerant to a certain level of any substance, for example, alcohol, cannabis, whatever that is, right? Similar thing happens in a behavioral addiction. Similar thing happens in a digital addiction as well, right? सारा आज ही कर लेना आप. ठीक है. ठीक है, सिमिलर थिंग हैपेंस इन डिजिटल एडिक्शन. व्हाट हैपेंस इज कि पहले हमारा मूवीज आती थी. वी विल वेट फॉर अ होल वीक और 2 weeks ड्यूरेशन for the movies to get released and we'll go and watch the movies, right? Then what happens? Movie culture shifted to web series culture, right? अभी मैं घर पे बैठ के सारे एपिसोड्स देख सकती हूँ, right? Then from web series it shifted to the reel culture, right? Then we have a lot of Instagram reels that we see. Then yes, like that girl said, right? Shorts, shorts. Has anybody now? I mean, I don't know if you're aware. This micro drama culture. Is anyone aware of the micro drama thing? Yes. 2 minutes drama, right? From all of these episodes which used to be 40-45 minutes duration, now we have episodes which are only 2 minutes, they're 90 seconds, those kind of things. And then 2 minutes ke bahut sare episodes. Why do you think that is happening? It's not happening by coincidence, right? These people are targeting us. They understand the neurochemistry of brain more than we do, right? What is happening is that now to get the same high, every reel or every content that we watch is becoming shorter in duration because we don't have that kind of attention span, right? It is much more faster, otherwise you'll feel it very boring, right? And it's much more brighter and louder so that it gives you the same high, right? That is why this is exactly how a substance addiction also works. Like I said, I need more and more amount of substance to feel the same high, right? So that is why there is this shift. I'll give you one very interesting example. I believe everyone will be able to relate to this. I believe all of you use ChatGPT, right? Yes. So you ask something to ChatGPT, what happens? It gives you an answer, right? It gives you a beautifully framed, politically correct, neutral answer, right? But have you noticed one thing? It always answers, I mean, it always ends the answer with another question. Can I make you a nice PPT format ready? Da, 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 da. Does that happen? Why do you think there is always a question at the end of an answer? That is the whole idea. Digitalizing, I mean, the whole digital culture understands the idea that we need to be hooked to something to keep us engaged. Again, if it gives you an answer, I get the answer, I go back, I do my thing. No, they want us to be hooked to that. That is the business model, that is the revenue model. That is why every answer is followed by a question. It ends with a question so that I still stay hooked there, right? Again, same thing, curiosity leads to dopamine high, right? So even if there is a question, I would stick to it for maybe 5-10 seconds more because it's leading to curiosity, which is leading to a dopaminergic high, right? That's the whole idea. So can we distribute the questionnaire? We did? Okay. So what's the first question in the question? I don't have it here. Can somebody read it out? Okay, just give me one directly. Thank you. Okay, so this is just a quick reality check thing. So are we on for the questionnaire? Everyone has the question, right? Okay. So the first question is, you open Instagram when you're bored. Yes or no? Yes. Okay. Is there somebody who's going to answer no? Sir, you will answer no? Yes. Sir has to answer no now. Okay. So second question is, you open Instagram when you're not bored? Yes. Is there somebody who is no here? You don't open Instagram when you're not bored. So what do you do when you're not bored? You go for a walk, cook something. तो रूममेट खा नहीं जाती वो? अच्छा, okay. And what else? Sing perhaps. Okay, that's nice. Third question is, you unlock your phone without a purpose? Yes. Everybody, right? Okay. Fourth is, you scroll during lectures. Sir, बैठे हैं, you make sure you answer this question. So we do open our phones during the lectures or rounds just for like 1 second, right? That happens? Does that stay for 1 second? It exceeds that, right? Okay. You fall asleep to a YouTube or a Netflix or a Spotify or something like that? Spotify? Yes. Okay. Your phone goes to the washroom with you? Yes. Does it shower with you? Yes. No. Spotify showers with you. Yes. Okay. So just a quick reality check. So I mean, this is not a questionnaire to diagnose you with something. I just wanted to make you guys understand that we don't even realize it, but you know, it's a powerful tool. I understand, yes, but it's also sort of become it's taking over a majority part of our life also, right? Okay. So again, since we are so overstimulated all the time, there is so much of dopamine which is always high and we are not giving it the time to replenish. What happens is that now we don't have a lot of dopamine to sort of have those cognition which is needed especially for a medical student. Our attention span will now reduce. Our concentration will become poor. Our focus will become poor. More importantly, I will not be able to register things, right? Somebody has said something, or I have kept a phone here, 10 minutes later, I don't even realize that I've kept a phone here and I'll be searching for a phone. Why do you think that happens? Am I being forgetful? Dementia? No. Early onset, young onset dementia? No. Probably, yes, but most likely it is. I don't think I look that old. Anyway, so the most likely answer is that I have not registered it in the first place to be able to retrieve or recall it, right? Memory has a lot of domains. You need to register something first, then you need to then only you'll be able to recall it and retrieve it later, right? Then half of you will come to me and say, "Ma'am, I think I have ADHD." How many of you think you have ADHD? Nobody? Yeah. You have ADHD. Why do you think you have ADHD? Easily distracted. Yeah. Okay. How many other people think we have ADHD? Unanimously नहीं लगता सबको सबको ADHD है लगता है Right. So, you know, in half of the cases, it is not actually ADHD. Like I said, we are so overstimulated that we don't have that kind of cognitive reserve to take things inside of us. Receptivity, you understand receptivity? We are not that receptive enough that whatever we read or whatever we do sort of gets inside of us, and then we feel that we are not grasping it any faster. Our concentration is poor. I don't remember. I get distracted. You know, again, it's a very overlapping diagnosis, but most of the cases we actually do not have ADHD. Anyway, so again, second year, third year students, anybody is aware of the idea of disuse atrophy? Yes, can anybody tell me what is disuse atrophy? When you don't use an organ, it will start dying or losing its functionality, right? Okay, perfect. That's a perfect definition of disuse atrophy. What happens is that surprisingly, you know, let's say 5 or 10 years back when we used to have patients, since I'm a psychiatrist, I'll be talking about psychiatry patients only, right? People used to come and tell us, doctor, I feel sad, I feel depressed, I feel anxious. Over time, we have seen this shift. People don't actually come and tell us that we feel sad or we feel depressed. These days, people come and tell us, doctor, I feel very numb, I feel blank, I feel nothing, you know, I feel robotic or I feel mechanical. Can anybody relate to that? Right? So that's a kind of shift we have seen these days. Why? This is called as emotional numbness, right? Emotional numbing or blunting kind of a response, right? And this is a new shift that we are seeing, and emotional blunting is sort of becoming the new normal. And I would like to call it, I will take the liberty to call it actually a new silent epidemic, right? Again, disuse atrophy. So why I'm trying to relate the two things, when I do not use an organ, it goes in a state of, let's say, atrophy, and it loses its functionality, right? Again, the same thing. I am so overstimulated, and also we have to understand that in most cases I'm not using phone because I'm addicted to phone. I am using phone because I'm addicted to the idea of escaping from the thoughts, escaping from the reality, right? If I feel stressed, what do I do now? Let me watch some motivational, some speaker reel or whatever, right? If I'm feeling anxious, what do I do? I'm sure I'll not go for a walk. I probably scroll. I'll scroll. I'll keep scrolling, right? So that's why I say that we are not addicted to this iPad or phones and everything. We are addicted to the idea of escaping from the unpleasantness of life, right? So we are trying to constantly numb ourselves. And that is why emotional numbness is very equal to sort of, disuse atrophy. Because when I feel sad, I don't want to feel sad, let me scroll. When I feel upset, when I feel anxious, I don't want to feel anxious, let me just scroll, let me just order, let me just watch reels or whatever, right? So I'm not using my limbic system at all. And again, disuse atrophy, right? Limbic system also goes in it. I mean, limbic system is the part of the brain that's responsible all kinds of emotions and everything. So that also sort of goes in a state of parallelly to a disuse atrophy where you don't feel emotions. Just like if I don't use my muscle, it'll start atrophying, right? Degenerating. Again, emotional numbing is equal to that only, right? Okay, one very interesting fact, by the way. Again, a shift of symptoms that we have seen over time. People who used to, smoke up marijuana or cannabis previously, when they used to go in a bad trip, they used to tell us that, when the paranoia sets in, right? When you say that, I think that somebody is looking at me, I think, that self-referential kind of a thing that, these two people are talking about me, these two people are relating, sort of making something up to sort of harm me, or, you understand, right? Paranoia. It's related to people or the surrounding kind of a thing, that depersonalization and derealization experiences. But over time, we have seen that kind of shift, that these days a lot of people, when they go to a bad trip, when the paranoia sets in, they say that somebody has hacked my phone, somebody is, sort of controlling something through my phone, there is an app that has been installed that is trying, you understand what I'm trying to say? That's a kind of shift in the symptomatology that we have seen over time. Just a I mean, a correlation that we have seen. Anyway, again, we stay in this world of hyper connectedness. Why? Because we are so used to the idea of getting an instant reply from somebody on the phone, right? If somebody doesn't reply us for 1 hour, we probably feel that, the person is angry, the person is hurt. I mean, maybe I've done something wrong. That's why she's not replying. That's why he's not replying. Does that happen? That happens? Yes. You might probably feel that I have been abandoned, right? The feeling of a fear of abandonment also kicks in. Although that's a very perceived fear of abandonment, that is not a true fear of abandonment. But that's how this pseudo connectedness can make you, change your perception about things and feelings in general. All right, so let me talk about a few simple, handy, practical tips, which you can sort of use in your day-to-day lives to maybe just cut down on your excessive phone. I'm not saying don't use phone at all. I mean, that's not possible as well. Let's just sort of that unnecessary using the phone, that can sort of go down definitely. So the first technique that we tell people to do is the charging station technique, right? What do you do in a charging station technique? When you're going to sleep, you actually keep your phone in a separate room for charging. I don't want to be anchored to the phone all the time. Why is that important? Because our brain is not capable to distinguish an artificial light from a natural source of light, right? So when I'm using a device, when I'm using a phone, there will be some sort of light source that enters my eyes, right? And from there, it signals my brain that it is actually day, while it is maybe 1 in the night. So the melatonin production gets delayed. Now, if the melatonin production gets delayed, my sleep will start shifting. I used to sleep at 12, it becomes 1, it becomes 2 a.m., 3 a.m., so on and so forth, right? So the charging station technique really helps you sort of have a structure to the day, because if you sleep on time, if you actually keep your phone away in a different room, you'll realize that you will sleep better, much more restful, and much more deeper state of sleep. And when you wake up in the morning, you'll feel much more like sort of awake and alive. That is one thing. Secondly, what we can do is we can use this 20 minutes detox pocket. Let's say I have a task 1 and I have a task 2 to do, right? So between the two tasks, most of the people probably will use phone, right? And while doing task 1 also they'll use phone. So the idea is just keep your phone aside for 20 minutes while I'm doing task 1, and then for whatever time it takes, and then I'll take a 20 minutes pocket where probably I'll do nothing, right? When I say I do nothing, it is very important to not do anything also, because otherwise it will create opposite of mindfulness, right? If I'm supposed to take a break, I'm actually supposed to take a break. I'm then not supposed to use phone and do things and everything, because it creates the state of opposite of mindfulness, that is mindlessness. And that is exactly what happens when we doom scroll, right? We are not scrolling with purpose, we are just mindlessly scrolling one after the other, right? That is second technique. Third thing that we all can do is to disable that digital dopamine. What is disabling the digital dopamine? Let's say there are important calls. So turn off all the notifications except for the calls. Try to do it for 2, 3 days, right? You will be surprised to see how calmer and how peaceful your lives will become. You know, even the Swiggy, Zomato, Mintra, whatever, Flipkart, Amazon, all of these notifications also, they take up our cognitive space. Right. And that is why you'll feel much more calmer when we disable these extra notifications that are not needed, that are not necessary. Right. And then, of course, we can replace this artificial high or artificial dopamine with a natural dopamine. For example, like how this girl does, right? What's your name, dear? Tanuja. Tanvi. Okay, so what Tanvi does is she cooks food. So what we can do is she will cook more food and we can all go to her and we can have the food, right? So we need to replace this, you know, artificial high with a natural high. For example, we can do anything, whatever we want, right? We can go, we have a beautiful campus, you can go for a walk, go for a run, maybe do some push-ups, whatever, right? You like painting, coloring, wash your clothes, whatever needs to be done, right? Take a shower if you have not taken for 10 days, that also is fine. Right, so we can do whatever needs to be done, but then it's, you know, it's very important. So what is mindfulness, right? It's important to be mindfully present in whatever we are doing. What is that? That means I am, the idea of mindfulness is that I am 100% present here and now, at the moment, in the very moment, and here, right? It's not that I'm standing here and something 10 different tabs are open in my head, right? That is something that's not good for doctors, definitely, right? Okay, so I think that's my time. I will take a, any other questions if you want, we can discuss that. Yes. Yeah. Yes, that's why I said that if your work is on the phone, just do the work, but disable the extra notifications that you have so that while I'm solving questions on Marrow, I don't think about what I can order on Swiggy because I got a notification from Swiggy. Even if they are off, no, but then that's fine, then use the phone. But while that work is, for example, you need to read something on phone, right? That's the only work, or do you have any other work on phone? Okay, as long as it's studies, right? Okay, fine. So let's say you have to read something on your phone, which of course, I mean, as medical students we have to read on phone, I agree, right? So let's say you take 40 minutes to read that, so do it for 40 minutes on phone. But when that 40 minutes time is out, right, at that time just keep the phone away. I mean, I'm not talking about that upside down, just don't keep phone besides you, just leave it behind, right? And then the 20 minutes pocket, then don't use the phone, right? Anything else? Yes, sir. Yes, sir. Yes. Ye- So, sir, we need to practice mindfulness. That is what. So, I am supposed to call you, for example, but I got distracted with something and then I sort of messaged or I did whatever I did and then I actually lost the track of what I'm supposed to do. This is some degree of mindlessness, right? Because I'm not completely present in one task and I am doing so many, trying to multitask. I understand we need to multitask in today's world, but we cannot any human cannot multitask all the time. Even as doctors, we can't do that. So it is very important that whatever activity I do, I am 100% mindfully present. So that's a beautiful concept of mindful shower, mindful eating. So we say that when you're eating food, just don't watch TV, don't use your phone, don't play a game, or don't read, or don't try to cram something. You know, if you are eating something, try to appreciate the temperature, the texture, all of those things, the taste and everything. So all your sensory organs are involved in doing one activity at that, you know, whatever 15, 20 minutes time. So it creates a state of heightened mindfulness. So that is when the distractibility component goes significantly down. Yes. Should we call it a lecture now? Or do we have anything else? Okay then. Perfect. Thank you everyone.
Thank you, ma'am, for the wonderful session. I think the detoxing has been fully done. And thanks for giving the blue pill to us. Let's say escape the matrix. So thank you very much. I think this has been a very interactive session. Most of the doubts have been solved. And still, if you have any doubts, you can ask now. And from Ascension 2025, we are really deeply grateful to you for your contribution, ma'am. And I would like to call upon the chief organizers to give a small token of gratitude to ma'am.
So next we'll be having a talk show with Dr. Sid Warrior. Uh, the talk show will start around 4 o'clock. Hello. Hello.
Hello.
Hello.
Hello, everyone here. Welcome to Brain Hacks for Mental Health session, where neuroscience meets practical strategies for resilience, focus, and well being in our demanding medical journeys. We are honored to introduce Dr. Siddharth Warrior, a distinguished KM alumnus with a MD General Medicine from SAIT GSMC, DM Neurology from SGP GMIMS Lucknow, and MRCP UK. As a consultant neurologist in Mumbai, his TEDx talk on neuroscience and creativity with 500K plus YouTube followers via brain hack content on neuroplasticity and dopamine and podcast on gut brain science. Also, he delivered keynotes at Singapore FinTech Festival and IFP conferences that have made complex neuroscience accessible and actionable for students and professionals. Please join me in a warm round of applause for Dr. Siddharth Warrior.
Thank you so much.
Now, I would like to call upon our chief organizers on stage to felicitate, sir.
This place is looking so beautiful.
Uh, we can start now.
So before we start, I have this. I suddenly had this memory. So I did my MBBS from JJ. Okay, so 2005 to 2011, I was in JJ, and during that time, my girlfriend at the time, now my wife, was in MBBS. Okay, and in her second year, there was a there was a debate on should doctors marry doctors, and there were two people arguing. For the against side was a radiologist. I'm not remembering his name. And for the for side, that yes, doctors should marry doctors, was Dr. Umesh Khanna, who is a nephrologist, also a KEM alumni. And Dr. Umesh Khanna happens to be my girlfriend's father. And I came to attend that event. Now, the thing is that he didn't know that his daughter was dating me. And I was sitting there in that corner, okay? And she was around here because obviously we can't sit together. And her dad was giving the talk. And after the talk, and he did very well. So after the talk, I came down. My heart was racing because I'm meeting my future father-in-law for the first time. And I just went and said, hey, this was a really good talk. And he shook my hand. And I could see Smriti over there saying, what are you doing? Don't go. And that was my first introduction to this hall. So it's amazing to be back here without that sense of anxiety, because after that, compared to that, this is feeling very, very relaxed. So thank you so much for having me back. So, ma'am, when I was a resident here, I'd come here to attend a few lectures again, but none of them as nerve-wracking as that one.
So, before we begin, I would like to say a few things for Seth. I have been his follower since the pandemic, like 2020, the pandemic struck. And since that, I started following him on YouTube. I saw his many videos on neuroscience of music, neuroscience of sleep. And that's when I heard the name of KM for the first time in my life. Like, in one of the videos you mentioned that I have done my PG from MD medicine from KM. So that's how I came to know about KM.
Wow. So, I'm so glad. I'm so glad I could get you here.
Yes, thanks a lot, sir, for that.
Although I must have done like 0.1% of the work, the rest of it you have done, but still.
So we would begin with the session.
Absolutely.
So I have a few questions for sir. So the first one would be the term brain hack. It gets thrown a lot online nowadays. So what in your view qualifies as a genuine evidence-based hack versus a myth?
Yeah. So anything that sells as a hack is essentially telling you that you can get something without putting in effort. That is what a hack is sold as when it's a scam. So money hack is, I will tell you a secret recipe for money that nobody else knows, and you can hack the stock market. That is a hack. There are lots of money hacks, there are a lot of relationship hacks, there are a lot of brain hacks. But what works will always take some effort. So that's how you know whether something is a hack or not. If somebody is telling you that you can get something without putting in effort, that is a scam. Now, in the list of things that do work, the thing that has the most evidence, simplest thing, most evidence for the largest benefit is breath work. Out of all the so-called hacks out there, if there is one thing that I want you all to take back today, is learning to breathe. Now, this is ironic. Everybody knows to breathe. You're all breathing right now, but you're not conscious of your breath. Now, this is something that has been described in yoga, pranayama, a lot of places in different ways. But in the last 10 to 15 years, the amount of evidence that has come out in how controlling your breath can directly affect your nervous system, your state of mind, your sleep, your emotions, your mood. It is close to a miracle. So, breathwork probably is the best brain hack that you can learn.
That's a very good answer, sir. So moving on, you have spent a very crucial part of your medical training in KM. So could you share some memories from those residency days?
Like, do you want good ones or terrible ones? Both.
Both.
My residency was amazing because I survived. The thing with residency is that you can just hear me. The thing with residency is nothing prepares you for it. So till the day you enter residency, you are a student. All you know is to open a book, learn something, by heart it, understand it, go to an exam, fill an MCQ form, come back, get a good rank. That cycle you know. And that does prepare you for a lot of things. It prepares you for success, failure. But residency is such a different game because it's not just mental, it's also very physical. And there is a lot of emotions there that you have never really faced before, especially if you are in a clinical branch. So nothing prepares you for residency. Only residency prepares you for residency. So that first 1 or 2 months in residency, you are simply readjusting your entire brain. All your neural networks have to change. I joined in May of 2012 and I was directly put in the medicine ICU. In my first day, I saw 7 deaths. Till then, I have seen 0 deaths. As an intern, I've seen deaths, but they weren't my deaths. They were not my patients. I had to fill in paperwork. I had to go and collect a form from somewhere. My patient has never died. On my first day as a ICU resident, 7 patients died. I have realized much later, in fact, I realized it after my entire residency was over, that is psychologically exhausting. Nobody prepares you for that. Nobody tells you that this is what is going to happen. Even doctors don't talk about that with each other. We just say that ye to hona hi hai. But this takes a toll. And over the next 3 years, you have to undergo a lot of psychological pressure moments like this. There is good in this because it prepares you for a life of healing and all the pain that comes with it because you cannot heal everyone. So KM residency prepared me for this like nothing else. After I left medicine residency, I can safely say that I have never felt overworked ever in my life. Ho hi nahi sakta. It's not possible. So KM residency prepares you in a way that nothing else does. Is it tough? It was very tough. There were moments where I actually felt कि मैं क्या कर रहा हूँ. Thankfully, your batchmates, the system, there are people that you can talk to. If you're lucky, there are friends who are with you, who support each other. And I had that, so I'm very grateful for that. So that is the dark side of it. That's the tough side of it. The good side is you learn how deep your resilience goes. So until you get pushed that hard, you don't really know what all you can take. And once you build that resilience, it stays with you. So I'll share one memory, which is, this was in my in my first year residency. I was in AGR unit. Are there any interns here who has worked in AGR unit? No, nobody's here. So AGR had Anjali Rajadaksha ma'am. She had her emergency on Mondays. Now that's fine on most weeks because you have the weekend where it's almost empty and then Monday is your emergency and the rest of the week you have to just take care of those patients. But once every 6 weeks, you have something called as a double emergency, which means that the Sunday emergency is also your emergency. So your emergency starts 8 a.m. on a Sunday morning, goes on till 8 a.m. the next day, and then your Monday emergency starts. So then you are only free Tuesday morning 8 a.m., which means तुम्हारा 2 दिन का admission हुआ है. Now the average number of patients that get admitted in one emergency is around 30 to 40. 2 emergencies around 80. In fever time, it can cross 100. So after that double emergency, I had 105 patients admitted under me across 6 wards, one of which was on the 9th floor. And once I got done at 8 a.m. on a Tuesday, I had to work up all those patients. And over those 2 days, I must have slept like half an hour on day 1, 1.5 hours on day 2. By the end of the 3rd day, I was hallucinating. I was like seeing, I remember it was 6 p.m. I was in the ward and I was writing something on the desk and I fell asleep. And I woke up and there was some light next to me and I thought it was sunrise. And I woke up in a panic thinking, abhi round shuru ho jayega. And turns out it was just some lamp. So for a few seconds, I was so confused. And then I told my friend that, listen, just take care of the ward for half an hour. I'm just going to go get some sleep and come back. These small little instances happen in residency. Is it ideal? No. Does it happen? Yes. Should you adjust? Yes. Because it passes. That's the beautiful thing about residency. It passes and then it's all in the past. None of it stays. But while you're going through it, you have to just take a deep breath and figure out how much more resilient can you become. Yeah. I don't want to scare anybody here about residency because what I've experienced is it is getting better. In the last 5 to 10 years, the number of residents are increasing. The kind of workload that is being shared is definitely lesser than before, but you will never know. That's my point. For you, it will be the hardest phase in your life. Was it worse before? Maybe, but you will never know. And that's the thing about hard things in life. It's all relative. So for you, it will still be the hardest phase. So be prepared for that.
So following that question, so be honest, like during residency, how many hours of sleep were you actually getting? And did you use any brain hack to survive on it?
No. At that time, I had no concept of brain hack. I was just surviving. On an average day, it would vary from 1 hour during emergencies to say 5 to 6 hours. You have to be very smart about it because if you are completely focused on only sleep, technically, you can finish your ward work, go have dinner and get 6 hours of sleep. But if you only do that for a year and you never hang out with your friends, you never go out, after a while, you can start feeling the effects of that. So yes, I'll admit there are a few nights where you tell yourself, you know what, forget about sleep. I need some time with friends. I need to go out. And then you manage that and you go out for 2 hours, sleep for 4 hours. So on average, in my first year, I must have slept 4.5 hours a night. Second year went up to 6.5 hours. Third year, again, it came down to around 5.5 hours. Because in KEM, second year is amazing. In second year, you have rotation. You are in all the other departments. You're not in medicine. So second year is really good. But third year, you're back in the ward. You're responsible. You have one useless first year who doesn't know anything, which 2 years ago was me. And you have to do all the work. So yeah, on average, that was my sleep cycle.
So now, as you said, hanging out with friends. So could you tell us about your friendship with Dr. Agni Kumar Bose?
Gossip. No, yeah, we are friends with benefits, all good. So Agni and I met through Instagram actually. Once when the pandemic happened, a few doctors started putting out content related to their fields on Instagram, and initially there were a very few of us. And somewhere along the way we got connected, and it was amazing meeting another person who was also from KEM. So there was an immediate bond that, arey, fellow sufferers, great. And then we've been in touch. We've been pretty good friends. It has been really good to have other people who have gone through that rigor of medicine. He's a dermatologist, and in fact, I think he was associate professor here in KEM for like a couple of years, and now he started his own practice. Who's also creating content, because none of us knew what content was until very, very recently. So it was a discovery for everybody. It doesn't matter if you were 25 or 35 or 45. Content creation was a new thing for all of us. So we were all learning at the same time. So it was useful to have somebody to talk about, discuss those things with. And yeah, we are still friends.
So, moving on. This is like a question from our like entire generation. So nowadays, the overall attention span of any average person, if you took, has reduced significantly thanks to the short format content like reels, shorts, etc. So, what are the ways in which we could overcome this problem?
I think you just had a talk on digital detox, right? Or digital de-addiction. And I'm sure some of this was already covered in that, but I'll explain very, very briefly from the brain's perspective what happens. It's not that we have a short attention span. We are paying attention as much as we think we need to. So the wiring in the brain is very clear. If something is valuable, you will pay attention. If something is less valuable than something else, your attention will change. So it's not really an attention problem, it's a value problem. Now the problem is when you are scrolling, the value of each reel is very transient. And you can observe it when you scroll. You open up a new reel, your brain gives it a lot of value. Ki, oh, ye kya hai? And then very quickly you can feel ki, are, ye to kuch nahi hai. And then you swipe past it. That is the reason why attention moves from one thing to another, because the value of that thing is less. If you want to increase your attention on anything, you have to increase the value of that thing in your life. That is the only way. You cannot force your brain to pay attention to something it doesn't value. Why can you not focus on your chapter a month before an exam, but somehow the day before the exam you're able to focus? The value of that answer is different. Why can you focus on somebody you have a crush on, but you cannot focus on your professor? It is all about value. How much value does that person, does that concept have? Your brain will give attention. So reverse engineer it. If you know that you want to give attention to something, figure out how to give value to that thing. Now, how do you give value to something? One way that I do it is, suppose if I'm reading something, I tell myself that I have to teach this to somebody in half an hour. Okay? It's a great way. If you can actually teach it to somebody, even better. Another way to do it is, you all use ChatGPT for something or the other. Take that topic, tell ChatGPT, make 5 MCQs on this topic and solve that MCQ. Immediately your brain will value everything that you were supposed to remember. So keep cross-questioning yourself and the value of that information will go up and you will pay more attention. So don't think of yourself as attention deficit. Please, don't think of yourself that you are not able to focus. Don't think that your brain is not concentrating on one thing. It's a value problem, not an attention problem. Okay? All right.
That's a great answer, sir. Sir, what inspired you to start sharing the neuroscience publicly, the neuroscience insights publicly? And following that, another question, was there any moment where you realized that people crave for this knowledge?
So when I was doing my MD medicine, I realized that I'm in love with the brain. Now there are many reasons why I was in love with the brain. One of them is, it felt like that is where all the understanding is still left. It felt, even though I know I'm wrong, but it felt like everything about the heart, the liver, the gut, you kind of know, but the brain felt very mysterious and it felt very connected to psychology, who you are as a person. And I was very interested in that aspect of, that aspect of medicine. So I knew that I wanted to do neurology. And once I got into neurology and I started reading about the brain and all the different aspects of the brain, and even though I was reading it from the perspective of disease, as to what can go wrong in Parkinson, what can go wrong in Alzheimer's, I started thinking about what can go right. And that is the difference between neurology and neuroscience. Because neuroscience is about understanding the brain when it is working the way it's supposed to work. And I realized that this is miraculous. There is so many things that happen in the brain that nobody knows. I've gone through 8 years in medicine and I was never told about the role that the amygdala plays or the role that the cingulate cortex plays in things that I'm experiencing every day. When I'm having a fight with my girlfriend, it's my amygdala that is getting activated. It is my sympathetic system that is pushing me into fight and flight. It is that sympathetic system that is making me close the door and walk away. These are things that is affecting me on an everyday basis. How do I not know about it? You would think that you should know about it, right? If your gut was giving you trouble every day, wouldn't you want to fix it? Similarly, if your sympathetic system is giving you trouble, shouldn't you want to know about it, especially as doctors? That's when I understood that there is a lot more to neurology. Neuroscience is a whole other thing. And then I started collecting all that information. Initially, I wanted to write a book, but then I realized that social media is the new book. This is where all information goes. And I owe a lot to a friend of mine who connected me to Tanmay. So Tanmay Bhatt, who's part of AIB, who's a stand-up comic, during the pandemic, he reached out to me through that friend and said he wanted to do a live stream because he wanted a doctor on his stream. And we were going to do just one. We were going to do neuroscience of humor. And the first time I realized that people liked hearing about this stuff was when the live stream started and there were 40,000 people viewing overall. And I realized that this is not just a niche thing that me as a doctor is curious about. This is something that everybody wants to know, whether you're a doctor or not. And then he told me that, of course, you should start putting this stuff up on YouTube. And I did, and I didn't stop. So I'm very grateful for him, and I'm grateful that I got to do all of this.
Yeah. Actually, that video, Neuroscience of Humor, I have watched it like at least 10 times. I have loved it that much. I'm glad. So, moving on, from your clinical experience, what's the single most common misunderstanding patients have about the neurological versus the psychiatric problems?
The commonest misunderstanding is that patients are faking it. This is very ingrained, that thought that if you cannot immediately find an organic lesion, an organic problem, if there is no blood report problem, MRI is normal, everything else seems normal, physical examination is normal, therefore, it's not real. The patient is faking it. Over time, this is changing, but I still feel like that streak is there and we have to fight against it. No patient that walks into a hospital is faking it. It's simply not worth it. Nobody would fake it. They all have some problem. It's up to us as medical professionals to find it. And if you can't find it, say that I can't find it. Do not say they are faking it. And this is especially true in the psychosomatic range of diseases. So patients who come with unexplained pain, fibromyalgia, chronic fatigue syndrome, patients who come with hysteria, pseudo seizures. Even when I was a resident, there were patients of hysteria who were treated as if they are doing it on purpose. They're not doing it on purpose. So that is the biggest misconception. Sometimes it's difficult to localize the lesion, especially when the lesion does not leave a scar. So MRI is normal. It does not have an effect on the blood reports. That's just because our tests don't match up. It does not mean that the patient is faking it.
Moving on, you have studied about the brain like very deeply. Did you ever look at your co-residents on a 36-hour shift and think like we are literally destroying our neurons?
Thankfully, no. At that time, That's the power of youth. We do think we are immortal. Residency में देखेंगे हो जाएगा कोई problem नहीं है. And there is some truth to that because our brain is very neuroplastic. Would I advise people to go through 36 hours of no sleep? Absolutely not. But can your brain survive not sleeping for 36 hours? Depends on your age. If you do it at a young age and then you make up for it, you can have a very normal life. You can have a very healthy life, no problem. When my residency was happening, we had the luxury of thinking that this was the only way to do it. It was either this or quit. And I didn't want to quit. I really wanted to do medicine. I was really convinced that this is what I want to do. And if this is the only way, then this is the only way. I'll just do it. And all my residents thought the same thing. And somewhere I believe that that made it easier. If someone had given us that choice of, no, there is another way of doing it, we may have had more trouble. But there was no other way. It wasn't like there was a hospital right next door where medicine residents were only working 6 hours a day. When we spoke to Naya residents, they were also living the same life. Science mein to aur bhi kharab tha, so we felt good when talking to science people. And I stopped talking to JJ people actually. But I don't want to compare residency with JJ. But there was always that feeling that if you want to do residency, this is it. This is the only way. And that really helped. There were no arguments there. It was just about, now that we are in this situation, how can we make the best of that situation? And we did. We tried our best. We found really nice places very close by where we can go and get anda burji even at 3 a.m. And those things really helped. So you find small little pleasures and make it very valuable. And then your brain feels, theek hai, I didn't sleep for 20 hours, but at least I had this. And you make do with that.
Now that we are back to the residency diaries kind of thing. So if you had to describe your residency life as a brain state, like the state of the brain, then would it be fight, flight, or freeze?
So residency does not give you time to fly, and there is really no opportunity to freeze also. You are pretty much in fight throughout, all the time. As soon as you're in the ward, literally, as soon as you enter the ward, you are surrounded by relatives of patients, patients themselves, and everybody has an urgent problem of different levels of urgency. It can go from, my reports haven't come in 3 days, to I'm bleeding from my arm for 2 hours and nobody's helping me. It can go everywhere. So as soon as you enter, your mindset changes. So in the morning, you're having breakfast with all your friends, you're having chai, it's all good. You're laughing, 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 and then you enter the ward and it's game on. Like, get to work, get to work. There's nothing else. So you're absolutely in fight mode. And that doesn't end until you leave the ward. And sometimes not even then. So as a doctor, you kind of learn to never fully switch off. And this is why I've seen so many doctors never get deep sleep. If any of you have family members who are doctors, you might observe, especially if they're in clinical fields or in ICUs, a small sound in the room and they wake up. And I think it's because of residency. You never enter deep sleep. You are still in level 1, level 2, level 3 sleep, and a small sound, a small disturbance in the room, you are up, because that's what happens in residency. Every day, एक बार तो phone आता है ward से. And unfortunately, the way that nursing is in Maharashtra, the nurses will not change IV lines or put in catheters, at least in government hospitals. In private hospitals, they do, but it's a very specific issue that happens in just government hospitals in Maharashtra. And so the number of times that I've had to wake up at 3 a.m., 4 a.m. because some patient ka IV line was out. Now that I think about it, it's kind of ridiculous, but we went through that. We did that. And ironically, when I went for my neurology DM in SGPGI in Lucknow, Lucknow doesn't have that. There, the nurses do the catheters, the IV lines. And I thought I was in luxury. I mean, so Wahape, I would get calls maybe once a night because some patient is having a seizure, and that is absolutely okay. But the fact that I don't have to change IV lines felt amazing. Whereas some of my co-residents who are from Lucknow would be cribbing about that. Arey yaar, raat ko 2 baar utna pada. And I'm like, do you know what luxury you're living in? So everything is relative. In KEM, yeah, like I said, some things you learn because of KEM.
So I would like to know about you personally. Like,
Hold on. Can you call Smriti and tell her that we are in JMLT? My wife is also joining us, by the way.
Nice. So, what were you like as a resident?
No. She'll sit.
Like, what were you as a resident? Were you the coffee-fueled zombie, all the calms and doctor?
So, I would usually be calm, mainly because I always felt that if you want to get your work done as a doctor, your main focus is that the patients should get better, right? That's it. That's your main focus. Your patients should get better. Now, if you are calm, you are able to communicate more efficiently. And if you can communicate more efficiently, the patient's relatives are calmer and things just get done better. So over a period of time, I've realized that calmness is an effective way of productivity. Rather than being all hyped up, like jaldi karo, it wastes more time. People get more hyped up, और गलतियां होती है, reports get lost, random things happen when you are all hyped up. You might think that you're getting more done. It might look like you're getting more done, but you're not getting that much done. So overall, calmness is the way to go. But in order to be calm, I was having a lot of coffee because you need that just for yourself. But calmness was a strategy for me.
Yeah. So, and also, like, did you ever tried any of the quick tricks like caffeine? Like, as you said now, you used coffee to remain calm. Like music, power naps that actually worked to stay sane during the duty hours.
I did use music. So there were two things that I did, which I didn't see a lot of my other residents do. Everybody has their own ways of coping with residency. So I had a small TV and an Xbox. And I had a guitar. And it's not like I'm great at playing guitar or something, but what I would do is when I would finish residency, I would come back and I would either play on the Xbox for 15-20 minutes or I would play the guitar for 15-20 minutes. And the point of it was simply one thing. I'm not going to let them take away my agency. It was almost like a rebellion thing. That even if I have only 4 hours to sleep, I will still play my Xbox for 15 minutes just to hold on to that thought that नहीं मुझे जो करना है मैं वही कर रहा हूँ. And I felt, and at that time I didn't fully understand it, but now I feel like that was so important because it's very easy to lose your identity or lose your agency, lose who you are, and you have to fight to keep that. Always. Not just in residency. I think that is a lesson that I have learned in KEM, but that has stayed with me throughout. Even later, once you get into work, there is a tendency for the world to carry you away and tell you that the only thing that matters is productivity. Like getting your work done is the only thing that matters and everything else is secondary. I think it is important that all of us find out what is it that makes you you and really fight to keep that in your life. And it's not going to be easy. It will be a fight. Again and again, the world will tell you that, अरे इसको छोड़ दे, इस पे focus कर. And you have to fight to keep that little thread of yourself. Bring that small little unique thing that makes you you into everything you do. And you'll find that things are more tolerable. See, you cannot decrease the number of patients. You cannot change the toxicity level of your department. None of those things are in your hands. But this one thing is in your hands. If you can find that and use it, it will change the way your brain sees that effort. And it will suddenly make it more tolerable. So for me, a little bit of music, a little bit of gaming, I would say it saved my residency.
And before coming to the final segment, what's the one thing you would remember for your entire life that KEM has taught you?
Wow. There were so many things, honestly. There are small lessons all the way to big lessons. One thing that KEM taught me is intuition has to be built. You cannot hope to be naturally intuitive. If you look at somebody and say, oh, they are naturally good at it, it means that they are simply hiding all the hard work that they did. Intuition has to be trained. And KEM helps to build intuition. Simply because of the number of times you have to do the same thing again and again and again, suddenly it looks effortless. It's not effortless. It's actually a lot of effort to look effortless. And this is across everything. Because that's how the brain works. The brain is simply neural networks connected with each other. So the more times you run that network, the more easily it will come to you. So if you want to be effortless at anything, you have to keep doing it again and again. And the truth is that unless there is a system that really forces you to do it that many times, you will not do it. The number of times that I have put in a central line, I counted till 100 and then I stopped counting. And this was in my first year. So after a while, I was able to put in a central line very intuitively. But that came after a lot of repetition. That has to be repeated across all your skills. So whether it is professionally, whether it's personally, whether you want to be intuitive in your hobby, whether you want to be intuitive in your relationship, you have to put in that effort again and again until suddenly it becomes effortless. And that switch will happen. It is not a miracle. It is not, will it happen? No, it will happen. Because it's like mathematics. It works in the brain in the same way, whatever it is you're doing. So that is something that KEM taught me, that simply repeating something is the answer for success. If you want to get good at it, just repeat it again and again.
That's a really great answer, sir.
Also, another equally important lesson is it will pass. No matter how hard you think life is or how horrible things are, nikal jayega. Just breathe. Just nikal jayega, whatever it is. However bad it is. You know, there are days where you think it cannot get worse and then it gets worse. That also goes away. And this is also not something we intuitively know. Because, see, the thing is, your brain has a limbic system, right? It's your emotional brain, your primitive brain. Your primitive brain is not wired to think long term. Your primitive brain is wired to only consider immediate, here and now. So if something bad is happening now, your primitive brain thinks यही है, मतलब मेरा life अभी झंड है, मतलब my life is just this forever. You, as the evolved prefrontal cortex person, has to tell your primitive brain that this will pass. Things will change, because it always does. It will always change. That is another thing that KEM teaches you.
That's a very inspiring answer. So now we are to our final segment, which is a rapid fire round.
Okay.
So tea, coffee, or a good nap? What actually saves your neurons?
Nap, always. If you can, Take a nap. Naps are brilliant. Naps are not a substitute for sleep, though. Remember that. Sleep has its own advantages. Naps are autonomic resets. Sleep is for cognitive health. Sleep is for brain health. You can take a nap or you can do deep breathing for 10 minutes and it has the same effect. So a nap will not help you remember things more, or it will not help detoxify your brain like sleep does. So sleep is different. There are people who say that I slept for 5 hours at night and I slept for 1 hour in the afternoon, so 5 plus 1 is 6, so I'm good. No, it's not. So you need 6 hours of sleep at night, but you can take naps as autonomic resets. There, that helps you with all your autonomic symptoms. So if you have anxiety, stress, low mood, all of that, naps can help.
The most brain fried moment of your career so far.
Yeah, I think that hallucination moment was pretty bad. Like, how is it morning? All right, I'll tell you one more story. Not a story that I've shared. And not a story that can go up on social media also. Turn off that phone. So, this was in emergency duty, okay? EMS में fever season, there were beds, but there are more critical care patients than there are beds. So sometimes trolleys can come in between beds. One patient came, acute gastroenteritis, dehydration, needed an emergency central line. Patient was on bed number 3. I'm like, okay, my senior told me, so that's central line. I turn, pick up the central line table, turn back and walk. My senior had said, central line, bed number 3. Now, between the time I turned and I turned back, one trolley came in between bed number 2 and bed number 3. And I'm on 36 hours of sleep deprivation. And I take out the line, okay, 1, 2, 3, and I turn the patient's head. The patient is like, what are you doing? I'm like, shh. Senior ne bola hai. And I'm taking out the injection. I take out the needle and I'm about to poke him. And then the senior comes and says, what are you doing? This patient is fine. And the patient is looking at me, my senior is looking at me, and the dehydrated patient is looking at me. Sir, kya kar rahe ho? Which is when I realized that, okay, need a break. Told my fellow resident, ki you put in, and I stepped out for 5 minutes, came back. Not a story that I would ever put out on social media, but there are things that happen in residency simply because it's Brownian movement, right? There is so many moving parts, so many things happening in such a short period of time, and everything is urgent. Chaos can happen. So we have to be as soon as we can, it's important to learn to calm down again and again. Life will keep stressing you out, and the more stressed out you are, the more chaotic things become, and the more mistakes happen. There is a line in chess, grandmasters say this, that if you're playing chess and you make a mistake, it's called a blunder. It's not the first blunder that loses your match, it's the second. So you make a blunder, you make a mistake. Now you're so annoyed with yourself that you make a second one. And that is even worse. This is what happens in life again and again. Every time you make a mistake, how quickly can you bring yourself back to your baseline? That will decide how good of a life you have. Because if you let the second mistake happen, that's when it becomes a spiral. So as soon as you recognize it, take a step back, breathe, come back to baseline, come back, things will be okay. Because everything will pass. Okay?
If your brain had a theme song, what would it be?
A theme song?
Theme song.
Oh man. Since we are talking about KEM so much, the Friends theme song is playing in my head because literally every night in order to sleep, I would put a Friends episode or something And because I've seen it so many times, even the words, the dialogue is familiar. So I don't need to see the screen, and I would just let it play, and then I would feel sleepy and I would sleep. And it's so ironic because uh, that song was so optimistic. That song was so cheerful, and the backdrop of KEM was so not. Um, so when you ask me that question, in my mind, that song is playing. But no, I don't really have a theme song. The song that relate to in terms of just life is the song by Snow Patrol. It's called Chasing Cars. Uh, and I was talking to a friend of mine recently about how he was saying that we keep chasing random things and we think that like a dog would chase a car, you don't know what you will do when you find it. And I realized that that is not a problem. The problem is not that we chase cars. The problem is picking which car to chase. So all of us need to find something that we are obsessed with. Now, obsession is a word that gets a sort of a negative term. Okay, why are you obsessed? But a life without obsession is difficult because life is hard and obsession makes it a little easier. So I would say that Chasing Cars is a pretty good theme song for the brain. Pick a car to chase and chase it. It'll be fun.
One brain myth you enjoy secretly just for laughs. Like nowadays, like people say you should do this and this will have that.
Um, there was a craze in the middle of ice baths.
Yes,
Did any of you try it?
I
You've tried it? Really? You put yourself in a bucket full of ice?
like ice cold water.
Oh no, cold water is different. Ice bath.
Not ice bath, but like
Really cold water. So that was really funny because when that craze happened, there were literally people jumping into ice, like literal ice, and trying to convince themselves that this is good for me, this is good for me, this is good for me. And that was really unfortunate because it's not. It's not good. It's good for a very specific subset of people in a very small subset of situations, which is basically athletes who need quick muscle recovery. That's it. And you just have everybody doing it. So that's one of the dangers of brain hacks or any of these health hacks, that you can take something and extrapolate it into situations that don't apply. And in some cases, it's okay because there's no harm done. But in some cases, there's actual harm done. So if you put yourself in ice, you are basically telling your nervous system that you are in grave danger, because ice activates all the pain receptors in your nervous system. And so you're pushed into an acute sympathetic state. You don't want to do that again and again. You don't want to tell your nervous system that you are in such an unsafe area. You want to tell your nervous system that you are safe. So don't put yourself in ice. Don't follow random hacks. Be as gentle and be as kind as you can to your nervous system, and intermittently, in a very, very controlled way, put your nervous system into stress. That is the way to go. Everybody understands it when it comes to working out, right? Everybody understands it. You need warm up, you need workout, you need increasing resistance. You keep increasing your weight. You don't go to the gym and suddenly put 150 kg and try to bench press. You start with 10, 20 and go up. Your mental health is exactly the same. Your nervous system is exactly the same. Keep increasing the stress slowly, slowly, and you will find that life is getting easier because your nervous system can take it better. So the ice bath challenge was a good lesson for all of us.
Sir, I would like to you to describe the brain in 3 words, but the word should not be complex, beautiful, or mysterious.
Describe the brain.
Brain in 3 words, but not complex, beautiful, and mysterious.
The brain. So the first thing about the brain is it's really chotu. It's just, if you crumple up the brain, it'll fit in your hand. It's like 1 kg, 1.2 kgs in weight. It's just mostly these little microscopic wires connected with each other. It's just this chotu baby in your head. And even in the brain, most of it is just happening automatically. What we call as consciousness, or what we identify as true consciousness, comes from a very small part of the brain. Most of it is happening by itself. And in very rare moments of introspection, meditation, you are aware of more and more. That's what meditation does. But for the most part, most of us are aware of very little that goes on in the brain. And that's the beautiful thing, that even without awareness, it's still going on. It's still working. It's still doing its thing. So I always think of it, and it's so scared. That's the other thing. That's why I said it's a chotu baby. It's a very scared organ, because for the majority of its existence, which is the last 3 billion, when did the brain evolve? 2.8 billion years ago. It has been in a constant battle for survival. It's a very scared, very small, tiny organ that is somehow responsible for everything. And that is such an unfortunate situation. Like, if you think about it, we have evolved from monkeys, right? Now, monkeys are not top of the food chain. Monkeys are not apex predators. Anything can kill a monkey. A snake can kill a monkey. Tigers, lions, anyone can kill a monkey. Monkeys don't act like apex predators. Monkeys only survive because they hang out together. Have you ever gone to like a safari and seen an apex predator, like a lion or a tiger? You've seen how they behave? They don't behave like monkeys. We behave like monkeys. Apex predators don't care. They're just chilling. Like 100 people are around, they're just doing their thing. हाँ यार photo लेना है लो, जो करना है करो. I go scuba diving and I see a shark. I know that's an apex predator. They don't care. There is something about the way an apex predator moves through the environment that is very different from the way we move through an environment, because we know that anything can come and kill us at any time. And our only safety is in numbers. And we feel so happy that I'm in a big room with so many people because I'm safe. If I was alone in this room, even though I know that this is perfectly safe, there will be a small little voice going, "Kya chal raha hai?" And if it was dark, I would definitely start getting more thoughts, right? Why? Logically, I know I'm safe. Why is there so much fear? Because the brain is a scared little animal. The sooner we accept it, the sooner we accept that this is what the brain is, then we can move ahead. The problem is, we are all told that we should be brave, strong, courageous people, and every time we feel scared, it's almost like, how can you be scared? No, it's ulta. We're all scared people, and some of us learn to be brave and courageous, and they should be celebrated. Fear should not be ridiculed. Fear is the norm. Anxiety is the norm. If you're anxious, you're normal. Try to come out of it. That is what life is all about, right? So that's what my description of the brain is.
So now if the audience has any questions, we could move to them.
Yeah. How attentive were they?
Sir, going to ask some controversial question now.
Oh God.
What do you love the most, KMPG life or JJUG life?
Oh. I mean, see, none of you have done JJUG by definition. So I can't really explain to you how amazing it was. But JJUG was really, really great. Um, I feel like I've had the best of both worlds because I don't think I would have enjoyed JJPG as much, but JJUG was just fabulous. It taught me that you don't have to study so much. It's okay. Which I feel like students from KEM don't fully get sometimes. I was just talking to these guys about the importance of rest, and you can err on the side of going too deep or taking on too much, because you really do need to build a lot of other skills. So while the ability to open a book, take notes, understand the topic is very important, it is also equally important to figure out how to be creative. It is extremely important to figure out what art form is your art form, because all of you have one art form, at least. And some of you have figured it out, but maybe you've kept it on the side thinking ये तो hobby है, जब time मिलेगा करेंगे. Some of you are following it, some of you have never discovered, and you think you are not artistic. That is such a disservice. All of you are artistic in some way, you've not found out yet. You have your whole life ahead of you. Keep looking for it because it is worth it. Especially now with the age of AI, you will find that the more algorithmic and by the book you are, the faster you'll be replaced. Because following an algorithm is exactly what an AI can do. And the more creative you are, the more spontaneous you are, the less replaceable you are. So all the things that was given a lot of importance 10 years ago has suddenly been flipped around. So please find your creative streak. Please find your chaotic streak. Please find your spontaneous streak, because it will come in more and more useful. In fact, when I'd gone to Singapore to talk about AI in the fintech world, the head of University of Singapore was telling me that they're now calling STEM, which is science, technology, engineering, mathematics, they've now turned it into STEAM. They've added A for arts. And they're calling it STEAM branches now because art is so important. So in our academic career, we have to make that choice between arts, commerce, and science very early on. But that is a big scam because scientists need art more than anything. Every time you create a hypothesis, that is art. You are creating something that did not exist before. You have to be artistic to think outside the box, to think, ये medicine और कहाँ पे use हो सकता है? That is an artistic streak. And once you start earning, that's commerce. Any doctor who starts a hospital, that's commerce. What are you saying you don't need arts and commerce? So please broaden your horizon, go out. And I'm not saying JJ taught me all of this, but JJ did teach me that there is more to life. And KEM medicine, KEM PG, I've already talked so much about it. I can never be, I will always be so grateful for setting that foundation. I think my life, for those 3 years of hard work, I feel like my entire life has been better for that. All right.
How do you balance your time as a clinical practice as a neurologist and a speaker?
So when I started creating content, it was the pandemic. And all doctors had some more free time than they were used to. So the way it started was I asked on Twitter that, hey, listen, all of you medical students who are sitting at home, किसी का lecture तो हो नहीं रहा है, do you want me to teach neurology? And I started teaching on Zoom. And I started putting up those videos on YouTube. And at that time, it wasn't taking much of my time, like maybe 1 hour a week. When I started creating content more regularly, it was taking more and more of my time until I went into a hybrid mode. So 3 days a week, I was in the hospital. On the hospital days, I don't open social media at all. And on the other days, I'm in my studio space. I'm shooting videos for YouTube, Instagram. Now, what has happened is, like everything else in life, you become more efficient at something. So earlier, a YouTube video for me would take like a day, and now it takes like an hour. And so I'm going back into full time medical practice because it turns out that I need only 3-4 hours in a week to create all my content. So this is something that will happen as you get better at something. And it's the same for patients as well. A patient that would have taken me 1 hour of history taking when I was in MBBS now takes me 5 minutes because you've seen 500,000 of those cases. So it doesn't take that long. So as you keep growing, the amount of effort that you need for the same outcome will reduce. So you'll just end up with more time. And so you can learn to balance it.
Sir, what is your favorite type of content, like a stand-up comedy or a panel, like relationship or the latent, or like a talk show? What is like, or
I
podcast?
loved Latent, yeah.
Yeah.
I loved it. I thought it was beautiful. I thought the way that Samay did it was so nice. I'm always hoping that it will come back. I like every form of content, especially in the comedy world. I feel I always loved stand-up comedy. I loved it even when I was watching George Carlin and Louis C.K. and all those guys. And then when Indian comedy scene came up, when the first AIB roast came up, it was so brilliant. I never thought I would get to meet all those people in person. And that was an amazing thing that happened in the last 4 years. So each of those shows, like even Relationship, which Ronak does, is such a brilliant, brilliant setup. And there are more doctors doing it now. And in fact, Angelika was telling me, the doctor who was just here, that she also does stand up. I really hope that more and more doctors do it. Just explore your funny side, explore your artistic side. My favorite type of content currently, there is this guy on YouTube called Ryan George. I don't know if you know him. He first came on this YouTube channel called Screen Rant, where he was doing a series called Pitch Meetings, where he would play both sides of the same character, a script writer and a producer. And through that, I discovered that he has his own channel. And currently, I'm on this binge watching streak of Ryan George, which is my entertainment side. And for my curiosity side, there's a channel called Veritasium. I absolutely love that guy. Just the way that he makes. So for me, physics is a branch that I left in 12th, and I loved it. And because of Veritasium, I feel like I'm circling back to physics. And getting back into a topic after you've gone very, very deep into another topic makes you realize that all topics are connected. When you're in school, you think physics and biology are different, but it's not. So many physics concepts apply to us, our decision making, because ultimately, we're all living in that same universe. So the laws of physics, the laws of atoms and molecules and thermodynamics affect us. So I have to be thankful to Veritasium for, closing that loop.
Thank you, sir.
From all the experiences that you've gained in the past few years, from content creation, moving abroad, choosing general medicine for doing MD, and then ending up as a neurologist, what advice would you like to give us medicos who have just started our journey?
I'll give you 2 pieces of advice. The ones that have been the most useful for me. The first time you read a topic, it is not going to stick with you. So don't be surprised. You will open a book and find a chapter completely underlined and remember none of it. That is going to happen. It's fine. The trick is how well can you do your second reading. So you can do your first reading as a formality, but if you can make some form of notes when you do your first reading, it will make your second reading more efficient. So do not count your first reading as ये chapter हो गया क्योंकि वो नहीं हुआ है. ठीक है? So, and I started this very late actually. I didn't do this throughout MBBS. I started this between my MBBS and MD in my preparation year. So if you are able to write down something, jot down something from your first reading, the next time you open it and you see something written in your own handwriting, your brain will bring back memories and your second reading will be more efficient. So if you can make that a habit, you will each discover your own unique way of taking notes, and it will keep evolving. There's no one perfect way of making notes. Each of you will make your own way, but make your own way. Because what will happen is, you will discover that there are some things in one chapter that connect to something in another chapter. And how you make that connection will decide how dense your knowledge is. If you think of each chapter, each subject as separate things, you will have to remember them separately. But the sooner you find connection, how is ophthalmology connected to physiology? How is microbiology connected to forensic? Once you start making that connection, suddenly the whole thing is one topic. And then it's easier to go between topics. And this is very, very useful in once you are preparing for your NEET PG and all, when there are 19 different subjects and it can just become overwhelming. If you can find cross connections, then you may be able to answer a radiology question because of something you read in micro. And बहुत time बचता है. But you should start making those connections much earlier. So if you're all in your second year, third year and you're doing your reading, don't read it thinking कि ये topic का, ये subject का ये chapter मैं खत्म कर रहा हूँ. Like that is irrelevant. Try to find connections between topics. That's number one. And number two is figure out how to set your studying stage. So how to get into that state of mind. And it's basically a way to train your body to get into that study mode. So for me, it was clear out desk, have one notebook open and have my textbook open, have a bottle of water and you sit. Just that action, it's almost like a ritual. But you practice that ritual again and again, your brain now knows that, okay, now it's time to study. It can be very simple. When I'd gotten into MBBS again, there was not, Instagram and all was not a problem. There was no too much of scrolling. There was a little bit of WhatsApp here and there, but nothing much. Now I think the challenge is more. I would really recommend that you turn off your phones and do that, because no ritual can keep getting interrupted. But yeah, these two things are really useful. Just jot down notes in some way and make a ritual for studying. Everything else becomes easier. Yeah.
So,
hello.
when did you decide to become a neurologist?
Already answered that. I was very interested in psychology, and I realized after getting into MBBS that अरे psychology तो arts के through था. And I had a bit of a shocked moment that, wait, isn't it biology? Aren't we dealing with health and patients, and why would one subject be through arts and everything else through here? And then I realized that there is another way to understand psychology, which is through the hardware part, the brain part. And that's what led me to this. Yes.
My question is related to that only, psychology and science. The question is happiness only a combination of neurotransmitter like dopamine, serotonin, endorphins, oxytocin and cortisol, or is there anything like philosophy, or like what is your opinion about it?
Yeah, it's a great question. The answer will be multiple levels. So happiness is an experience. You experience happiness. Now the problem is that word, like similar to love, at different points in time, we mean different things when we say we are happy. So if I give you an iPhone, you will say, oh, I'm so happy. But if you come first in your NEET PG exam, you will also say you're happy. But these are different kinds of happiness. We don't have different words for it, but these are different kinds of happiness. So there is a happiness that comes from getting an unexpected reward suddenly, which is primarily dopamine. So dopamine as a molecule evolved because we are wired to take some risk, and when we get a reward, we feel happy. But there is also a different kind of happiness which comes from emerging out of hard work. If you are doing something over a period of time, again and again and again, and something comes out of it, there is this gradual sense of satisfaction. And that is more of serotonin. Dopamine will rise and fall. All the happiness that comes from dopamine will quickly go away, and you're coming back to normal. Serotonin happiness kind of lasts. Now, these are still very, very naively put, because the truth is that happiness has many chemicals. So serotonin, oxytocin, opioids, cannabinoids, there are many, many chemicals that come together to give you the experience of happiness. But the core concept is, are you happy on something that is temporary, or are you happy as an emergent property of something that has been going on for a while? The basic rule of thumb is that transient dopamine happiness disappears, and that's the norm. You don't have to be shocked that, oh, this iPhone meant so much to me when I first got it, but now it's not giving me happiness anymore. It's wired like that. You should aim for happiness that comes after consistent effort, because that happiness kind of lasts and it gives you that feeling of satisfaction again and again and again, right? So the serotonin happiness primarily is about identity. Do you identify with that thing? So say, for example, if you set up a clinic and you identify with that clinic, every day you go to work, you are happy. But if you buy a iPhone and there's nothing about the iPhone that is saying this reflects you, then you won't be happy. That is the difference. Okay? All right. Yes. What are your thoughts on manifestation? Manifestation has got a bad name because it has been sold as a very pseudoscientific concept. And that is very unfortunate. Basically, what manifestation is we are faced with endless choices all the time. Right? At any second, any moment, we can do anything. How do we decide what to do? We need to have some goal. If you don't have a goal, we will get pulled by whatever is calling out the loudest. This is basic life. This is what happens. If you go to a supermarket and you say, "Dekhte hain na, kuch to kharidenge," you will end up buying junk. If you go and say that, "I want to buy all the things I need to make a sandwich," then you know that you'll only buy bread, tomato. But even then, if you're not sure of what you want to make, you might get confused because you'll see an ice cream there. And you'll say, "Acha chal ice cream hi le lete hain." So at its core, manifestation simply means, have you announced to yourself what your goal is? And if you've announced to yourself, it has a lot of downstream positive effects. It reduces the number of choices you have to make. It reduces your anxiety because things will keep going up and down. If you don't know why you're doing this, it is not going to work. So for example, when I was preparing for my NEET PG, I knew I wanted to do medicine. One could say that I manifested doing medicine. And so every time I would get a low mark in a test, I would be like, no, itne mein mera rank nahi aayega. I need to work harder. That, because I had decided that goal was there, it helped me work harder. Essentially, that is what manifestation is. What it is not is the idea that you put out a certain frequency and people and things of that same frequency come to you without you doing anything else. That is a problem. When I see people selling the idea that just say BMW, and a BMW will come, that is not manifestation. What it is goal setting, and that is a great way. Another close term is visualization, and I would recommend everybody do this. Like, do not visualize final outcome. Do not visualize six-pack abs. You're not going to get six-pack abs. But you can visualize simply putting on your shoes, opening the door, and going to the gym, because that is the hard part. And the more you visualize it, when you go to sleep, tomorrow morning, I'm going to wake up, put on my shoes, open the door. Visualize that 2-3 times. When the morning alarm rings, your brain will find it easier to get up and put on your shoes because it's already rehearsed it. If it's not rehearsed it, there is resistance. So that is where it actually helps. And you should do it. All of you should do it.
So,
Yeah, go for it.
Sir, when we talk about progression in the career, right? So there are very much two concepts which is famous is going by the flow or having it all planned. So as a second year MBBS student, should I have it all planned at what I'm going to do in MBBS, what I'm going to do after MBBS, or should I explore more about other subjects? Should I wait till maybe final year and see which subjects excite me more? But what if it's too late by then? What if I don't find anything exciting?
Yeah. So the key to growth in life, across at any stage in life, is to focus on skills. You don't really have to worry about the final destination, but what you should worry is, can you think about it as going on a road trip? The most important thing is, can you drive? It doesn't matter whether you're going to Goa or Kerala. Can you drive? And can you become a better and better driver? The better driver you are, even if at the last minute you decide कि और कुछ करना है, ठीक है ना, you just have to take a turn, it'll take a few more days, you will get there. But if all you're focused about is destination and you don't focus on the driving skills, everything will be difficult, right? So if you can learn how to learn, if you can figure out how to absorb a topic, if you can learn how to connect, if you can learn how to teach, if you can learn how to connect with different topics so that an MCQ question can be solved with another knowledge, if you can improve your logical skills, even if you don't know the answer, can you rule out two options and then pick between two so that your odds double? Those are skills that you should practice on. The final destination, which is what field do you pick, honestly don't pick in second MBBS because it will change. It will change. It should change. It is not good to know what you want to do too early on in life because then you are actually closing out options. And then you might, even if you like something else, you might feel like, "Arey, maine decide kiya tha. Am I being untrue to myself?" You don't want to make all that. You don't want to make life difficult for yourself. So if you like something, great. Keep that. But the way the world is changing right now, there is a chance that the dream field that you would love doesn't exist today. There is a chance that it's not even been invented yet. So absolutely keep it open. You don't know what all is going to happen in the next few years with AI and the way that biotechnology is coming up. You don't know where all medicine is going to go. So just be very good at learning and taking care of your body, taking care of your mind. Everything else will come easily to you. Okay. Thank you so much, guys. Okay, one more question and then that's it.
So, sir, as you have mentioned previously, that our attention tends to be on things we value. So, in life, empathy, curiosity, or learning, I want more of my attention towards there. But I tend to focus on things which emotionally triggers me, like comparison, stress. So, how do I give more value to this things?
Yeah. So here is something that all of you need to understand. At any given point, your nervous system is fluctuating between sympathetic and parasympathetic. So sympathetic is fight and flight, which is also when you're anxious. Parasympathetic is when you're calm, you're resting, you're feeling safe. The more sympathetic you are, the more your brain will spot threat. Now, you can ask yourself, how threatening is your environment? And everybody around you will have a different answer, depending on where they are on that spectrum of sympathetic to parasympathetic. So if all you are spotting is comparison or danger in some form, what you need to do is to not focus on the comparison part. The focus has to be shifting your state of mind from sympathetic to parasympathetic. And there are exercises for this. This is why the first thing I said was breath work. It might sound too simple. It might sound almost silly. Ki how can breath work have such an effect? All of you should try it. There is a breathing exercise called resonance frequency breathing. The effect is very simple. You have to do 4 seconds of inhalation, 6 seconds of exhalation, and as you exhale, you either hum or you chant Om. Basically, you're vibrating your vocal cords. If you do this for 10 minutes every day, over the next 15 days, you will spot a shift in the way you look at the world, in the way you experience the world, amount of threat you see, things that seemed annoying are okay now, friends that seemed very irritating are more tolerable now. It's just a general shift in your nervous system. And once you get used to this parasympathetic side of life, every time you go into sympathetic, you're immediately aware कि हाँ ये थोड़ा अलग लग रहा है. But the problem is that all of us are spending so much time in sympathetic, probably because of social media, because it is wired to keep you in sympathetic, that we are all considering this as normal. सबका heart rate अभी थोड़ा बड़ा ही है, सब थोड़ा anxious ही है, we are all a little fidgety. None of us can sit for too long. And that is a problem because this has become normalized. So learn to shift towards parasympathetic. Let this be the norm. And so when you go there, you know कि ये थोड़ा अलग है, I need to come back. Then all those thoughts and everything will come down. Got it? Perfect. You should all try it 10 minutes every day without thinking. Just do it. And 15 days के बाद मुझे बताओ कैसा लग रहा है. All right. Guys, thank you so much. This was an absolute pleasure. Thank you.
Hello. Thank you, sir, for such a wonderful session. You walk us through the entire life journey.
Amazing. Thank you so much, guys. Thank you. Lovely.
Thank you, sir. Thank you, sir, so much. I think sir gave us our buffering lives a chance to reload. There were a lot of controversies solved and quite a few questions that the audience had. And we are truly grateful for your viewpoints, and we had something to learn from it. So thank you so much. We are grateful from Ascension, and we would like to present a small token of appreciation. I would like to invite the chief organizers to present that. Yes. So if you would agree, we would have a quick photo session with the audience. Yes. So first the organizing committee, who those who want to click the photos, please click it. Then the audience. Yes. Please form a queue. It would be in an orderly fashion. No chaos, no chaos, no chaos.
Yeah, form your groups, not individual.
And only in groups.
Not individual.
Shubham. JC. JC, please come to the stage. Yes. Lupa ma'am. Okay. Please come to the stage. Those who want to click a photo. कौन ध्यान में?